Bismillahirrahmanirrahim. Assalamu alaikum and good day, ladies and gentlemen. On behalf of Comstech and myself, I welcome you all to Comstech IILM joint workshop on healthcare leadership, global models for transforming systems and culture. Esteemed guests, colleagues, and our respected speaker, it is my distinct honor to welcome you all here. And I would like to share with you all that this workshop is being held in a hybrid mode. And through this workshop, we will be hosting senior leaders from across the healthcare ecosystem of the OIC member countries in this hybrid model. We are already joined by different participants from different OIC member countries, as well as some non-OIC member countries. OIC member countries. And this workshop, ladies and gentlemen, will be facilitated by Dr. Zakiuddin Ahmed, who is a renowned leadership coach and a founder of IILM. And ladies and gentlemen, this workshop comes at a very crucial time when across the globe, health systems are grappling with complexities of workforce, challenges, and resources. Ladies and gentlemen, with your permission, I would like to thank Coordinator General Comstech, His Excellency Professor Dr. Muhammad Iqbal Chaudhry, for his enduring commitment and providing leadership. We will begin the program with the recitation from Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الرحمن علم القرآن خلق الإنسان علمه البيان الشمس والقمر بحسبان والنجم والشجر يسجدان والسماء رفعها ووضع الميزان ألا تطغوا في الميزان وأقيموا الوزن بالقسط ولا تخسروا الميزان صدق الله العظيم.
Jazakallah. Ladies and gentlemen, now I would request His Excellency Professor Dr. Muhammad Iqbal Chaudhry, Coordinator General Comstech, for his welcome remarks. Over to you, sir.
Bismillahirrahmanirrahim. Assalamu alaikum. Good morning, good afternoon, ladies and gentlemen, girls and boys. I'd like to welcome Professor Dr. Zakiuddin Ahmed, the key resource person of this series of workshops, which we intend to conduct in next few weeks. And Dr. Zaki is a very prominent leader in the field of healthcare. He has been the founder of many very important organizations, and his contributions are immensely important in terms of reforming and reshaping the landscape of healthcare in Pakistan and elsewhere. We wanted to have the benefit of his contributions and expertise spread over OIC countries, and I'm so absolutely pleased that Khazima and her team were able to actually gather online participants from some 18 countries, starting from Afghanistan, Azerbaijan, Bangladesh, Benin, Burkina Faso, Egypt, China, Cameroon, Gabon, Kenya, Malawi, Sudan, Togo, Uganda, United Kingdom, New Zealand, and Yemen. And that actually reflect the immense interest we have in the topic. And topic is certainly very, very important because here we're not really talking about conventional uh, run-of-the-mill healthcare reforms, which are often discussed at various forums. Here we're talking about reformation of leadership role in healthcare. And we have seen that during the pandemic, we have seen that in pandemic, there was a gross failure of governance. The leadership in healthcare was the most vulnerable part. It was the weakest link in the long chain of healthcare provisions. And this is where we intend to contribute, along with a very valued partner, IILM, which is an abbreviation of a very important organization called, which is Institute of Innovation, Leadership and Medicine. And that is reflective of very important dimension in healthcare. We have seen that during the pandemic, there were many very important gaps and voids identified, but perhaps the most important was national priorities where healthcare was not really placed on the high. The second was the governance structure, which was failed. And in an era defined by rapid technological advancement, global pandemic, increasing health inequities, and systemic challenges, leadership in healthcare can no longer be confined to traditional administrative roles, which we often see all around us. It must evolve into a dynamic force, one that understands policy, empowers teams, embraces innovation, and above all, keep patients and communities right at the center of all activities. And since Comstack is working in a whole range of various important development endeavors, health is a very important component. Apart from its traditional role as a STI, Science, Technology, Innovation institution, health become increasingly more important as it is directly relevant to everything else which we discuss. And let me take this opportunity to explain to you what Comstech is trying to do in terms of key challenges and opportunities in this area. Comstech has initiated capacity building initiative, joint research programs, and specialized training in areas such as infectious and neglected tropical diseases. And in this case, we have many programs organized all over African and Asian region. Bioinformatics and genomic data analysis, and that is also inclusive of many activities which we are conducting overseas. Traditional and integrative medicine, we are working closely with WHO, and we were able to provide them our insight and our experiences of working with 57 countries which are part of Comstech Ministerial Standing Committee. Health biotechnology and biomanufacturing, working closely with many countries like Indonesia, Iran, as well as with organizations like International Center for Genetic Engineering and Biotechnology. We have been contributing in this cutting edge healthcare provision. And very recently, Comstech has compiled AI Vision for OIC, which include digital health and AI in medicine, which is a very important uh, aspect of what AI can provide in terms of futuristic healthcare dimensions. We, in the domain of healthcare, we provide research grants, technology transfer partnership, and multinational collaborative programs. And the objective is to somehow fill the gap decrease disparities and asymmetry between the countries and institutions. You see, science and technology alone is not enough. Uh, you can have the best of healthcare facilities, you can provide the best of equipments, you can have best doctors and paramedics. Most important is how you utilize them in the most effective way, and in that case, leadership become critically more important. Uh, and this is where this particular course is centered around. It is precisely why this workshop is important and critically important because it's just not about models, it's the mindset which demand quality, which mindset which demand empathy, understanding, and mindset which demand patient-centered care. At Comstech, the OIC Ministerial Standing Committee on Scientific and Technological Cooperation, we view health not only as a scientific or economic issue, but as a moral responsibility and driver of unity, equity, dignity of human race for all, including the Muslim world. I'd like to take this opportunity to sincerely thank IILM Foundation, HRAP, for their dedication and their outreach, that now we have this program as a launching pad for a much larger collaboration which we intend to develop with them. As we are engaged over the course of this workshop, I would request you to kindly take the benefit of this wonderful opportunity, engage in dialogues, and make sure that you understand what eventually leadership role would be. I take this opportunity of thanking my colleagues in Comstech, Hazima Mosam and her wonderful team, for putting together this very important event, which is already a blockbuster in terms of participation from various countries. Thank you very much. My apologies that I've not been able to be with you. I just traveled last night from Islamabad to Karachi for my onward journey abroad, and hopefully we'll be able to see you during the next workshop. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum. Thank you very much, sir, for your kind words and for a very compact welcome remark. So just to give an idea to our participants about the technical expertise of Dr. Zakiuddin. Dr. Zakiuddin is a strategist and a healthcare entrepreneur, coach, and a mentor, and a physician who specializes in fostering collaborations to create a patient-centric, effective, and innovative healthcare system by building an ecosystem of developing capacity of the stakeholders and establishing institutions. The areas of interest and expertise and experience that he has includes digital health, as His Excellency mentioned, patient safety, health research, healthcare leadership, lifestyle, and integrative medicine. Ladies and gentlemen, we hope that this workshop will go beyond the technical expertise and will help us think deeply about why and how leaderships in healthcare matter and how we can adapt ourselves with evolving healthcare landscape across the OIC member countries, including Pakistan. With this, I would invite Professor Dr. Zakiuddin for his first technical session on illustrating the need for leadership in healthcare situational analysis. Please welcome Dr. Zakiuddin.
Assalamu alaikum. Bismillahirrahmanirrahim. Assalamu alaikum and very good morning to all of you who are present here, and good afternoon, good evening, depends where the online participants are from. First of all, I would really like to thank Professor Dr. Iqbal Sahab, who, as a visionary, immediately appreciated the potential of what we have launched in just one conversation which I had with him. And it was just a very simple, brief conversation which I had with him. Obviously, we knew each other for a long time, but this conversation, when we had this conversation with him, as a visionary, as a leader, he immediately appreciated and realized that this could be a very potential collaboration between different organizations. So I really want to thank Professor Dr. Iqbal Sahab
Thank you.
for making this happen and having the vision to facilitate and catalyze this collaboration between comstech, IILM, which is Institute of Innovation, Leadership and Medicine, and Health Research Advisory Board. So these three organizations will, inshallah, add significant value in terms of capacity building and in terms of contributing in the leadership journey of each one of you and all those who are present online. So Dr. Iqbal, bahut shukriya. Thank you very much. Jazakallah khair. I want to thank Dr. Ismaila for leading this execution. So we had a few conversations, and so I thank you for allowing me and our two organizations to be here. And this is just the first workshop which we're having, and despite heavy rains, so when I was coming from the airport in the morning, I was expecting that there will be no one here today because it's raining like cats and dogs, as we say. But it's really encouraging to see all of you here and definitely the online participants. So thank you very much, Ismaila, for your leadership. And last but obviously not the least, Khazima Saiba, who without her, I don't think we would have been able to organize this at all. So I really want to thank you for your seamless and prompt and very diligent execution style and collaboration with us. So Jazakallah khair to you. Thanks to all of you again. As I said, coming attending this workshop in this rain is definitely difficult. So with that introduction, I will start, inshallah. And as Dr. Iqbal mentioned, this is just the first workshop or a session, I would say. It's not a very typical workshop because we have such little time and most of the participants are online. So it's kind of a hybrid thing. But it's just the first. So we'll be having maybe not monthly, but maybe once in 2 months, workshops on research, on leadership, and digital health, which is my first area. So today, we'll start with this, and the first session is about the introduction and need for leadership in healthcare. So a lot of times leadership is associated with politics or government and countries. And I have seen that people do ask this question: leadership in healthcare. We need to be clinicians only. We need to be pharmacists. I'm a good nurse. That's good enough. I'm a physiotherapist. That's good enough. Why leadership? So we're going to talk about that. So I want you to know me, and I would have loved to know all of you, but the overwhelming numbers, especially online, will only make us explore, when we have the list, and then we will get to know, each one of you, inshallah. But this is my background, as Khazima Sahib also mentioned. So I'm a physician by training, but I immediately started working in telemedicine 29 years ago when I learned about this from an American hospital. And alhamdulillah, it was kind of an epiphany. And Allah subhanahu wa ta'ala gave me the tawfiq to decide that telemedicine is going to be my calling for the rest of my life. At a very early age, at the outset of my own career, and I brought this concept of telemedicine to Pakistan very early, around 29 years ago. And you can imagine, what would have happened to me when I started talking about telemedicine. But digital health, obviously my first love. My second love is patient safety and quality healthcare. Again, a very critical component of healthcare and health systems. And I'm the director of RIFA, Institute of Health Improvement and Safety at the University of Islamabad. And I'm also the chairman of the International Conference on Patient Safety. So we do very active work in patient safety as well. The third is health research, which is our partner organization. And again, we established an organization in Pakistan, which is a not-for-profit organization. And all our board members, including myself, we have been working in this organization pro bono, just for one cause, which is to promote and develop the health research ecosystem in Pakistan and across the world. So obviously we started with Pakistan, which is our circle of influence. And then also, healthcare leadership. After realizing and after learning about healthcare and health system, I decided that this is something which has to be part of my journey, not only to develop my own self, but to help everyone in healthcare on their leadership journey. Because without leadership, we cannot have an efficient or an effective healthcare system. So I became a certified trainer of 7 Habits of Highly Effective People, one of the most famous programs out there, unconscious bias, and started developing my own programs and started training and helping, as I said earlier, healthcare leaders in their own journey. And I'm going to talk about that a little. And then my recent love for lifestyle and integrated medicine for the last 5 years, again, is based on the need. And I'm going to talk a little bit about that. So that's my background. I'm both an academic professor as well as an entrepreneur and some other. So this is the Institute of Innovation Leadership, which I established, and with the same mission to help healthcare professionals. And please note that this is not for physicians only. It is for all healthcare professions, because healthcare is not only about physicians. And that's one of the biggest mistakes we have made in the last 60, 70 years, that we have kept healthcare limited to physicians. And our objective is to empower professionals to become inspirational leaders. So this is why we started that. And this is my journey under leadership. So I became a formally certified trainer of 7 Habits, certified by Franklin Covey US, because before I can help others, I have to develop my own self, and that's what I did. So alhamdulillah, with those certifications and with these international collaborations, which means that these are the organizations who have helped me so that I could help you. And this is, the essence of collaboration, partnership, and communities. We all help each other to deliver something which is meaningful. These are my models, which we have developed at IILM. This is the life model, where we have these 7 domains of a meaningful life. Then this is my lifestyle integrated medicine model. I call it Self for Health, which has 4 components: sleep, exercise, lifestyle, and food. And this is our main focus. How can we reverse disease? Yes, we want to prevent disease, but how can we reverse disease? Yesterday, I was speaking at a large audience, and one of the speakers before me said that, when you have diabetes, you have it for the rest of the life. And when I came after him, I had to, not in a difficult way, correct him, but clarify that no, if you have diabetes, you can reverse diabetes. You can become diabetes free if you want. That was an older narrative. So that's why we have developed that. So this is again one of the contributions which we are making. So we are establishing these scholar, we call it scholar, it stands for safety and digital health, etc., at leading universities in Pakistan. And we would love to establish this model of scholar, where we talk about all of these 5 areas and develop our healthcare professionals. Again, not limited to physicians. Every stakeholder in healthcare needs to be developed in these 5 areas, and we do it formally by establishing the Scholar Center of Excellence at leading universities in Pakistan and hospitals. And this is the model of leadership I'm going to talk about later in the fourth session. So these are different sessions which I have taken, alhamdulillah, trained maybe thousands of professors and doctors and CEOs and medical directors. This is when the Punjab government asked me to train all the medical directors and CEOs of the Punjab government on 7 habits. So that was a great opportunity. And this is our own journal, which we share with people who we want to help. This is the journal which everyone. So whenever you are on your journey to leadership or self-development, please have your journal. We can talk about that later on. So what is my expectation from you today? So that was my introduction. That was the backdrop, right? So my expectation is that please have a learning mindset. And that means that we have to be willing to unlearn with humility. Humility is the essence of learning. If we have this arrogance that we know everything, then we will not be able to learn or not learn the complete, thing which we have been put in front of us. So we have to be, very humble, and we should be ready to unlearn. I think that's the first. Second is be present, don't be distracted, especially today, because what I'm going to cover, or I'm going to try to cover in 3.5, and I'm looking at Khazima Sahiba because I really wanted more time, because the content which we have today is extremely difficult to cover it in 3.5 hours. So it means that I will need your, your focus and without any distractions. So, and I know it's difficult. Take notes. Do not try to remember. We all know as educationists, within 45 minutes, we all start to forget things which we have understood and remember. So don't even try to remember. Even the smallest things which you have learned, write them down. And in my journey in the last 25 years, I have notes as old as 20 years in my computer when I used to attend workshops and sessions. And those notes help me even today. So please take notes and ask questions. Definitely during, maybe offline would be better. So let's start. Why are you attending this session? This is the $1 million question. This is the most important question for this workshop or for this session. Why are you here? And why do we call this as a $1 million question? Because if we are not, if you don't have this habit, or if you don't have this default, whenever we start something, if you don't ask why you're doing it, I think we get lost. So please write down in the next 1 minute, why are you attending this session? What are the reasons, 3 top reasons? Why are you here? And all my colleagues who are, attending online, please write down this, the answer, 3 points, 3 reasons why are you attending this session. Just 1 minute and we'll move forward. And you can complete this if you cannot think of a reason, you can write it maybe further down the session. But please address this question. Please ask yourself, why are you here? Or why are you attending this session? Okay, so we all know this. There's nothing permanent in this world except change. We all know that. As a matter of fact, a lot of things which I'm going to talk today, most likely you would have already known all of those things. So these are not new things, just like this slide. But, the the purpose of having these slides come up again and again and in a conversation is to emphasize how important these statements which we have been, hearing ever since maybe I don't know how many years, but there is nothing permanent except change. And how many of you, again, ask yourself, how many of you are comfortable with change? Honestly answer yourself. How many? So ask yourself, am I comfortable with change? Personal change or changing environment? So am I comfortable that my beard now is white? It used to be black. I have to wear glasses, right? Am I comfortable with that? Am I comfortable with changing, myself? So ask yourself this question. And then we need to be clear, and we'll see that in 7 habits as well, that you start with ourselves. First, change yourself. And then, obviously, help others. As we hear this every time we sit on a plane. So Rumi, obviously, the wise person said it in a perfect manner. So we start with this, that change is permanent, and before anyone else, I need to change. This is the underlying premise. Okay, but why do we change? So there are 2 ways. Actually, the third group, I'm not going to talk about the third group. The first group is we learn enough that we choose to. So these are the proactive, wise people, right? You present something in front of them, they understand, agree, and decide that, okay, I'm going to change. This is the second group. Maybe the smokers, maybe people who smoke or drink, and even when they have maybe the first ischemic, a heart attack, then they have to. So that's a reactive change. And then you have the third group, which does not change. So where do we want to see ourselves? In the first, second, or third? Leaders place themselves or should be placed in the first group, a proactive change. So they find something, even if it is completely contradictory to what they have been, believing for the last 30 years, with an open mind, and they say, okay, I'm ready to change. Because that is the only way they will grow. So again, a question, why we need leadership in healthcare? That was the question of the session today. So let's look at, and I call it the situational analysis. Let's look at healthcare. And let's look inside, right? Critique. Let's do a critique. Do any of you disagree with anything which I have written on the slide? Do you all agree that we have a lot of medical errors? Access is still a problem. Universal coverage? I don't know. Cost? I think Khan is sitting here, was the CEO of Al Khan University Hospital. Maybe he can tell us, better than I can. Healthcare workforce, and I'll talk about this. Chronic diseases, everything is, just wrong. So let's see. This is one of my favorite slides, and I always put it in front of my audience. So this is the kind of the father of modern patient safety, and he is Professor Lucian, a pediatric surgeon, Professor Emeritus at Harvard. So imagine, you cannot go higher than that, perhaps. Harvard, Professor Emeritus, surgeon. Look at what he says. Modern healthcare is the most complex human activity there is. Most complex. And then look at what he says here. We haven't figured out how to make that work well. A Professor Emeritus surgeon working at Harvard for 35, 40 years has the humility to accept that we don't know. Something is wrong. Something is wrong. Please do not portray that, oh, everything is hunky-dory and now we have the perfect hospitals and we have the perfect healthcare system. On the contrary, and I'm going to show that. And I'm going to create the link with the situation analysis to the need for leadership. So these are embarrassing slides for us, for all of us. In the US, more than 400 physicians commit suicide every year. That's more than one a day. And these are the ones who unfortunately get successful. Just imagine the pyramid. Thousands attempt or thousands are depressed. Or only 400 plus they succeed. But that's not, a small number. And, we talk about the nurses burnout. You read about it in UK, NHS, all over the world, even in Pakistan. We all know this. This is embarrassing. We have created this. Physicians have created this. Pharmacists have created this. Healthcare leaders, so-called healthcare leaders, regulatory, CEOs or directors. We are responsible for this. Again, now you can, see the wisdom of humility. Because in my watch, if I am the leader, and if these are the numbers, I should take responsibility. So if in the last 5 years, under my watch, the antibiotic resistance has gone up, I need to take responsibility. And leaders take responsibility. If you do not want to take responsibility, then maybe you are leader by virtue of your position, but not the leader which we are going to talk about today. Embarrassing. But look at the vision of this person who created the first antibiotic. Why do we say that? Because he was a leader and a visionary. And he knew even at that time, and I'm sure everyone would have laughed at him, but he knew this was going to happen because he had vision, wisdom, and insight on how people, exploit things. Again, very embarrassing. Again, this is where we work in patient safety. Now, 10%, according to WHO, 10% of patients are harmed while in a hospital. Some would argue 10%, only 10%, right? 90%. But if I am part of that 10%, or if my father or my child, 1% is also, too much. But in Pakistan, we argue that it's around 25-30%. And it's global. So patients are harmed. Why? Because we are all humans. The word is human. It says it all. So what do we need to do? We need to develop leadership and we need to create systems and cultures. And that's what we're going to talk about today. Third leading cause of death in the US has now become not a disease. It's preventable medical error under my watch. I am the CEO of a hospital, or I am the Minister of Health, or I'm whatever I am. Under my watch, people are dying, not because of cancer, but because of preventable, and I emphasize again, preventable medical error. And they continue to die while I continue to celebrate my successes. So we need to stop. We need to be humble as Professor Lucian. Humility. So this is just something I created today. A paradox in healthcare. Obviously, these are not accurate exact numbers, but it's just to give you an idea to what's happening. What is the paradox in healthcare? So since 1980, we have more hospitals and we have better hospitals. Agreed? More hospitals and much better hospitals. We have more drugs. In 1980, perhaps we had 5 drugs for diabetes. Now we have these magical wonder drugs, more than 20-25, right? In every disease. Research, maybe 1,000 times more. Every person has 300 papers, 200 papers, 50 papers. Okay, good. We're spending more money. Any guesses? How much is the global healthcare expenditure per year? Any guesses? $8.5 trillion. You don't spend this much amount This is big, huge. Okay, so we're spending more money and we have more specialists. So in 1980, Pakistan did not have a professor of diabetes. Today, we have maybe 50 professors, super specialized consultants, trained diabetologists and endocrinologists. Just one example, yes. So we have all of those five. So everything has grown, alhamdulillah. But what has also happened? We have more disease. All, not most. And you can check, it's a tall claim. We have numbers, we have evidence. All chronic diseases, not only that they have not been, eradicated, but yet they have not even been reduced. All chronic diseases have gone up, despite more money, despite more professors, despite best hospitals, and despite a lot of research. What's going on? This is a paradox. Something is missing, right? So, every conscious person would ask, why? Why is there a disconnect? And in leadership, something which I have learned is to ask the why question. Why? A researcher does that, and a leader does that. Why? Why are we failing? Why is this happening? Ask yourself, ask others. So let's take the example of smoking. So a lot of people knew at the outset that smoking is harmful. But how long do you think it took for the healthcare community to accept and agree that, okay, there's a causal relationship between smoking and maybe, lung cancer? How many papers did they want, the healthcare community wanted to be published before they would say, okay, we agree? 10, 20, take a guess. How many papers would you need to create a causal relationship between a hazard and a disease? How many would you need? 100, 200, right? Okay. So these are ads. I'm not going to spend time. This is embarrassing for me as a physician. In the US, in 60s, up until 60s, physicians and dentists used to come in the ads. As physicians come in different ads today in Pakistan. Right? Journals had talked about smoking, and they had ads in journals. Right? But look at this. The healthcare community needed more than 7,000 studies. More than 7,000 studies. Where were the so-called leaders or regulators? Were they sleeping? What was going on? Why? This is healthcare. This is what we are dealing with. And now go back to Lucian's point. The most complex activity. So now you would appreciate the linkage between the situational analysis and the need for leadership. We did not have leaders. A leader would not have waited for 7,000 papers to be published until he would say or she would say, okay, so we are leaders, we are part of the, let's say, the pulmonology group, and 300 papers, 3,000 papers, I don't know, have been submitted, and we are still saying that, no, it's okay. Why? Think about it. Think. You will get the answers. I don't want to go deeper because if I go deeper, it gets embarrassing. And I'm part of that community. 7,000 studies, even the Surgeon General of the US stated, and our fraternity community did not accept it. It took a few years even after that. Just an example of smoking. What is the smoking of those years today? Anyone? Top drinks. Top drinks. We have hospitals serving soft drinks, for God's sakes. And I asked the CEO, my friends, Come on, what are you doing? And you are a diabetologist and you are a professor and you have 300 papers and you attend conferences. This is simple. You are killing people in your hospital. And yet we claim something different. What does it take to take a courageous decision that soft drinks are banned? The government cannot do it. I understand the reasons. But why can't we, as healthcare leaders, why can't we do that? By the way, at my university, Rifa University, we've already done that. No soft drinks. In my conference, in patient safety conference, even if I get a pressure from, it is not possible that we serve soft drinks in our conferences, but we still get those. Ask yourself why. You will get the answer and you will realize why we need to develop ourselves as leaders. Because it takes a lot of courage to take a stand for something which is so simple, yet no one will listen to you. Okay, so the current healthcare system is, and we can agree or disagree, unsafe, obviously, we can see that, we have the numbers. It's expensive, we have the numbers. It's inaccessible still, we all know that. WHO says that. It's inefficient and ineffective. The current healthcare system, period, khalas. This is our conclusion or inference of this small situational analysis that the current healthcare system is not working properly. Hence the results. Hence the increase in all, not most, I'm repeating, all chronic diseases. I'm not talking about infections. So our good friend Einstein said we cannot solve our problems with the same thinking we used when we created them. So we need to change. What brought us here is not going to take us there. Remember that. You may write it down. What brought us here is not going to take us there. This is what this is a leader's mantra. Because he or she is agile, ready to change. You give him evidence, he'll say, okay, fine, I was wrong. So we need to shift from, this is how I was trained. Maybe still physicians practice this way. If I have said, I'm a professor, let's say, of, cardiology, and if I say something, that's the end. No. Now we live in a evidence-based, culture or society. But this is how we were trained. Doctor/disease centricity to patient centricity. This is what the second report told us. Crossing the quality chasm. And this report actually talked about one missing link in healthcare. And you know what that was? Patient centricity. The report said that healthcare has one thing missing, and that is patient-centered healthcare. It's not about patient, it's always about the doctor or the disease. So we treat the disease and the doctor gets the benefit. Doctor becomes next to God, if not God. And the second is from sick care to healthcare. So this is a paradigm shift. And to make that paradigm shift, we need leaders. And that's our introductory session. Why do we need leadership in healthcare? Why are we sitting here? Why have I traveled from Karachi? Why have you guys in this rain traveled? Why have numerous people, I don't know, 50, 70, 100 people have joined online? Because it's not working. And we need to have these two shifts. So what is sick care system? This is sick care. So Stephen, who was the CEO of the University of Maryland Medical Center, defined and wrote a book on it. Sick care system is one that waits until we become ill before it kicks into action. This is called reactive approach. So I'm waiting for something to happen and then I'll fix it. I will fix it. And a lot of time we need that fixing. But that's not going to solve the whole problem. It will solve that issue, that instance. But the whole healthcare actually today has become sick care, as Stephen said. So this slide will give you a snapshot. What is the difference between a sick care system and a healthcare system? Very simple, very clear, makes sense. But do we follow that? Again, we need to ask ourselves. So you can take a picture and we can share that, but just to give you a comparison. So physicians and healthcare providers, healthcare professionals need to decide and choose whether they want to become medical managers, and I use this word or term, medical managers, because medical managers are those who work in sick care system. They manage things, or they become physician or health scientists to work in healthcare system. So healthcare system needs more physicians or healthcare professionals who are scientists, as opposed to medical managers who wake up in the morning to fix things in the day and then go home. And yes, they do a great job in fixing things. I would not take that away from them. I need fixing when I break my leg. I need to get it fixed. But that's not healthcare. Healthcare is something else. So again, visionary people. So Mayo Clinic and Dr. William Mayo is always respected as one of the visionary leaders in healthcare. And look at what he said many years ago. The best interest of the patient is the only interest. Halas. It's not about shareholders. It's not about anything else. He had the vision to say something at the outset when there was no concept of patient centricity. But he knew that. And that's why even today, Mayo Clinic, you can differentiate Mayo Clinic a little bit from other hospitals, because it was founded by a visionary leader. This is another leader in our healthcare, Sir William Osler. How many physicians do we have here? Any physicians? Okay, so William Osler is considered to be the father of modern medicine and a pioneer in medical education, started Johns Hopkins and a lot of things. Just look at the last statement. One of the first duties of the physician is to educate the masses not to take medicine. So, and again, another visionary saying the same thing. So these are visionaries, but we're not listening to them. And since we're not listening to them, we get the result, which is antibiotic resistance. We didn't listen to them. We didn't listen to the person who invented, created, developed the first antibiotic. We didn't listen to him. He envisaged at that time that this is going to happen. We didn't listen. We didn't listen to any of the other visionaries. And hence we got, so cause and effect. Remember, cause and effect. This is how nature works. So leadership in healthcare. So we talk about Joint Commission. There are 4 or 5 hospitals in Pakistan. They're getting more. Joint Commission also keeps human factors and leadership, not technology, not money, not training, not anything else. Leadership and human factors and communication at the top. So what do healthcare leaders do? First of all, they create a safe and just culture. Justice is perhaps one of the most important things which leaders establish, whether it's in their hospital or whether it's in the country or global. Safe and just culture. Leaders make their organizations a learning organization. What do you mean by a learning organization? What do you mean by a learning person? A learning person goes back, remember, is humble enough. A learning person or a learning organization. So you have been leading Aga Khan, right? A university hospital. So as the leader of Aga Khan, Khan's responsibility and and I'm sure that he was successful in it to a large extent, is to make the whole organization a learning organization. And a learning organization is humble enough to accept that we don't know everything and we make mistakes, and we are willing to know more from people who know more than us, and we are ready to change. We are ready to change. Humility and acceptance to change. That is called a learning organization or a learning individual. And that's what leaders do. That's how they create a culture. High reliability systems. So under my watch, if I'm the security guard of this place, what do you expect from me, sir? No thefts. I cannot say that, yeah, in the last month, we had 17 thefts, and I'm still working, very efficiently. Can you say that? But this is what we say in our hospitals. This is what we say in our hospitals, that yes, 10-30% of the patients can be harmed because we are saving so many lives on the other side. High reliability. If you come to my clinic, if you come to my office, you should be sure that the service is going to be reliable, right? And leaders create leaders. If you want to ask yourself, or if you want to assess yourself, am I a leader? Just ask this question, the last one. Don't go into the details. Have I or am I creating future leaders? Okay, you've not created a future leader yet, but are you doing it today? If you're not even doing it today, then I'm sorry. You may be a CEO, you may be a director, but you're not a leader. Because if you're not creating future leaders, you're not a leader. Khalas, period. And how do you do that? You do it through mentorship, through engagement, and we'll see how it's done. So the 21st century physician and healthcare professional leader has to be well versed in his or her expertise. So if I'm a cardiologist, if you are a pharmacist, we have to be a good physician or a nurse. That's given. But these are the other areas where I have to excel and develop if I want to be a healthcare leader for the 21st century. Otherwise, we will become redundant, as we are becoming redundant in the age of artificial intelligence. We all are becoming redundant in the age of artificial intelligence. So if I'm becoming a physician or a nurse today, and if my university is not teaching all of these, then I'm sorry, the university is not doing their job well. Even if the medical student is a very good student of embryology or physiology or anatomy, if you're not training them all of these, then we're not really doing service to them. So these are different. Now I'll just skim through different models which are available globally. This is CanMeds. This is the Canadian model of healthcare leadership, established how many years ago? 25, 26 years ago for the residents. So they decided that their residents should have these competencies 25, 26 years ago. The Canadian Royal College of Canada decided that for every resident, we need to teach them, obviously, cardiology, but all of these things. And what were we doing in Pakistan or maybe some other countries? We were just focused on making them good surgeons, which obviously is important, which is needed. I won't take that away from a surgeon or a cardiologist or a nurse or a pharmacist. But what about this? Similarly, look at the other model, NHS. NHS had their own healthcare leadership model. And I'll just dupe. So you look at any major healthcare system or even the government systems, and you will not find an exception. You will not find an exception, other than obviously our part of the world. So look at this. You already put the patient at the center. Just look at their system of leadership. This is their leadership model. I showed you the NHS model. This is the Canadian LEADS model. Lead self, LEA, engage others, achieve results, develop coalitions, systems transfer. This is the Canadian model. Again, a different model. Look at Harvard. This is one of their, most sought after programs, the SQUILL program. And link it with, the slide that I showed you, Scholar. They are creating future leaders who know about safety, quality, informatics, which is digital health, and leadership. BMJ, leading the leadership drive globally. They have a journal dedicated for healthcare leadership. There has been an organization for more than 50 years trying to bring together physicians as leaders. National Center. Then we have this how strengthening leadership skills can help surgeons achieve quality and safety in the operating room. So I'm just going to show you the significance. Look at the nursing leadership. So this is the American Association. They have a dedicated institute within their society, within their association, where they train all the nurses. And I'm going to show you the result of this, which is going to throw you off from your seats. And I showed that in this respective conference. And a lot of my friends, they were not very comfortable. And I'll show you. Keep this in mind. Keep this in mind. Pharmacists sitting here. So the American Pharmacists Association has a leadership program. Every society globally, every association, every major hospital, every government has a proper, formal, structured leadership program for their healthcare professionals. Orthopedic Society. Now look at this. Can you believe this? This is one of the most arrogant college of cardiology, the American College of Cardiology. And who is, the president and CEO of the American College of Cardiology? A nurse. Why? Ask yourself, why? How come a nurse became the president and CEO of this biggest college where we have these big cardiologists with these big egos, and the president is not a cardiologist? Think about it. Think. Because she, despite being a nurse, developed herself and competed and got the right position which she deserved. And she's a female, by the way. Nurse, female, president of this organization. Think about it. Okay, 2 stories and then we close today. This is Dr. Ignas. My favorite story. Does anyone know who he is? I can't ask my Zoom participants. I'm sorry, but maybe next time we can come up with a system. So Ignas is a physician, or was a physician. But this story is about the power of simple means and the consequences of not using them. And I repeat, link it with smoking and please link it with soft drinks today. Simple thing. One order by the university vice chancellor, the CEO of the hospital, we will not have soft drinks in our hospital. But we don't do that. And then the consequence. So what happened was that he's the person who actually told us that during the process of childbirth, he as a physician observed more than 100 years ago, simple observation, that during the process of childbirth, if the physician and the nurse simply wash their hands, the infection can be reduced. Simple observation, right? What happened? The physicians of that time with big egos, what did they say? How dare you? How dare you? And they ostracized this poor guy for saying something which is now the ABC of our hospitals. He was ostracized and he died in the asylum. Then another story. This is Ernest Codman. He was also a physician, just like Ignace, and he said something maybe as crazy as perhaps what Ignace said. And by the way, we are still unable to do what he said 80, 70 years ago. We're still not doing this. What did he say? So I am called eccentric for saying in public that hospitals, if they want to be sure of improvement, I don't need to improve. I'm a surgeon, for God's sake. I'm a neurosurgeon. I'm a tall male neurosurgeon. I don't need to improve. Must find out what the results are. Must analyze the results. Strong and weak point. Must compare the results. Let's go to other hospitals. Must welcome publicity, not only for their success, but for their efforts. And this is the guy who said this 78 years ago. I can't say it today because if I say it, I get ostracized. And he said that. And he was ostracized. So he used to live in the East Coast. He was ostracized and he had to leave the East Coast. But there's a difference between Codman and Ignace. Ignace, unfortunately, was not a healthcare leader. But Codman was a leader. So he left East Coast, shifted to Chicago, became a member of the American Society of Surgeons, created a steering committee and a group on quality, which led to what? Joint Commission International, the JCI, which we call today. And Codman Award is the topmost quality award in the US today. Just contrast. He did a brilliant thing. I feel sorry because he was not a leader. He did not have those skills which we are now trying to teach our healthcare professionals. How to communicate, how to collaborate, right? But Codman was very smart. So he left, he went to Chicago, and then he became, and now this is the most prestigious quality award because Codman was a healthcare leader. So I close here the first session. Are we willing to change? Number one. Again, ask yourself, commit to yourself, are we willing to change by doing what? Reducing medical errors and practicing safer medicine, working as a team. Unfortunately, physicians are trained in the opposite manner. We are trained as champions, as individual champions. We are not trained to be part of a team. And Professor Paul Barish, Hans knows him. He's part of our team at RIFA. He's a very celebrated quality and patient safety person globally. Came on the Oprah Winfrey show as well. He and his colleagues created a program called Team Steps. And Team Steps is just a program like this, where they train teams in the hospital. No technology required, nothing is required, just a few days. And you know what happens? You reduce mortality. How many training programs do you know which have shown to reduce mortality? Simple things, very simple things. No need to have a budget of $1 billion or $10 million or $10,000. A simple training session, Team Steps, reducing mortality. What are we waiting for? What are leaders waiting for? Simple things. Prescribing antibiotics just judiciously, empowering our patients and making them our partners. Come on. Do you think that physicians consider patients as their partners? I don't think so. they consider them, or we consider them, as recipients of instructions to follow. That's a completely different paradigm. Utilizing technology, proactively creating health rather than reactively managing disease, and then becoming leaders to proactively creating what? Health, not sickness. Efficient systems, and safe patient-centric culture. And I'm going to talk about culture as well. So we stop here. The first session comes to an end where we talked about a little bit of what is healthcare, where do we stand in healthcare, the situation analysis, being very courageous, very candid, just like who? Just like Professor Lucien, who was humble enough and courageous enough to say this 26 years ago. In 1999, the first report on quality and safety came out in 1999, and the title of the report was "To Err is Human." And Professor Lucien was instrumental in bringing that report. So he said something around 27, 28 years ago that we have not figured out. So he was accepting his failure, a professor emeritus. So we looked at that, and then we looked at the global models of leadership. Everyone in the mature systems are investing in healthcare leadership. We need to invest as well in our circles, in our hospitals, in our organizations, wherever we are. And then we looked at two examples. So why do we want to become healthcare leaders? Because we don't want to end up a martyr like Ignis. We want to end up like a hero as Godman, right? So I stop here, and I don't know if we are doing well for time. Khazima Saiba, any questions or comments? Maybe a very brief. So we take, how much time do we have? Khazima, please. Yes. Dr. Zaki.
Maybe we can take few questions.
So how much time for the questions? 2 minutes, 3 minutes, 4 minutes?
I think we can have questions for 10 minutes.
Oh, okay, great. Please, sir. First question.
I don't have a question,
Oh,
but I have some comments and ideas.
sure.
Which encourage you that both center was fantastic. But we have to get some ideas.
Mhm.
Those are the main ideas.
Please, sir.
As you look at it and you all every time the leadership. And I will add a word to the leadership that is mentorship.
Mhm.
The leadership.
Okay.
Then it works very fine. So we cannot leave mentorship away from the leadership. One thing. Second, you talked and you mentioned a little bit about the proactive. So we don't have a proactive approach. Even in our country, even the countries which are the third level,
Yeah.
I will say, the developed.
Yeah, we don't have to.
Yes, we don't have.
So we have to have it.
We have to.
Yeah.
And third thing, you have mentioned when you're mentioning the smoking thing, that is the science communication developing the awareness. So if communication is very important, you don't have a communication with your patients, you don't have a communication with the other people who are
Right.
taking care of them. So developing
Great.
science communication is very important to have awareness.
So thank you very much, Dr. Javed.
That's all on my.
One more, sure.
Second, in leadership, you have to talk about the justification, but the dedication is also very important. So if you have a dedication, inbuilt dedication, it is inculcated in your social system. It inculcated your mechanism of social system. You will do everything.
Great, thank you very much for the 4 points. So we are noting those points. Thank you very much. Any other questions? Yeah, please.
So you've talked about telemedicine, initial steps.
Yes.
I want to know, where is telemedicine in Pakistan? Is in countries like Canada or US? You don't have to go to the patient directly for smaller problems. You call them up and they address the problem. So where is telemedicine in Pakistan? I know about Shifa, only that caters to the problem is on phones. I don't know about the other hospitals. Do you have a comment on this?
Yeah, so that question is, where is telemedicine in Pakistan? So the answer is, we have more telemedicine than Shifa. There are other programs, there are other companies doing it. But the correct and the courageous answer is that we are not where we should have been. So let me give you an example. Around 20 years ago, WHO developed the National E-Health Toolkit, the policy toolkit for the whole world, right? And that is the National E-Health Policy Toolkit, which every member country has to adopt. And it was developed by 3 people, and I was one of those 3 people. And I thought that since I'm a Pakistani, the first Pakistan would be, the first few countries to adopt it. And unfortunately, we have still not adopted. So the answer to your question is that yes, we have more companies now coming up, right? But we are still, again, embarrassingly lagging behind. And I can give you another example. So 25 years ago, in 2000, I was invited by India at their first international telemedicine conference. It was the first time they had a telemedicine conference, and there was no one from Pakistan, so they invited me. And I went there, and we didn't have any telemedicine at that time. And I saw that there were companies in India which were selling telemedicine equipment in that conference. The Indian Army was showing telemedicine projects. The Space Agency of India was showing telemedicine projects. So yes, we are far behind, unfortunately, and that's why we need more leaders to take this forward. Next question, please. Anyone else? Question, comment? Yes, please.
My question is that you talked about there should be collaboration and coordination among people from medicine side. But I feel that one of the core issue is when you talk about in leadership we need to change. And how does you identify the change? That is through research. And I think so community is not very willing to accept the basic scientists because a lot of data is being generated and that data. Being a microbiologist, I know that a lot of work is being done on antibiotic resistant into trends we know, and how those trends and how to change it is not being accepted. And therefore, I think so there is a severe or dire need for the change in aptitude and attitude. And one of the things we should mention already, that mentorship should be there. The leaders mentor, and the culture of medicine in Pakistan is very different. Still, the doctors have that attitude that no patient can question them. And for me, I've kept on because I'm a scientist. Every time I go or visit or talk to people, I have a data of 100 people who talk to me and they say, "Oh, I went to the doctor never listened to me." So these are the issues where the change can start. The change has to, is it going to be top to bottom approach or bottom approach?
Yeah.
And as you mentioned, you're talking about the top to bottom. So
So
how do you feel about it?
So first of all, I echo, and everyone, I think, agrees, and we all agree. So in Pakistan, we're very good at identifying the problems, right? We all know what the problems are. So there's corruption, there's this, that, the other. We all pretty much, we know. What we need to address, and that's your point, question, or comment. How do we solve this? So, for instance, you start with research. So this organization, which is part of this consortium, the Health Research Advisory Board, we established this organization. Again, 45 healthcare leaders gathered in Karachi with the humility of accepting. And by the way, these are like top clinicians, mostly they were clinicians, top clinicians in their respective fields, known as the best surgeon, the best cardiologist, all 45. But they had the humility when we were forming this to accept, and we kind of agreed on our statement that Pakistan is embarrassingly lagging behind in health research. And we all agreed that, okay, this is the situation. Now what do we do? What do we do? First, identify the problem in the way the problem exists, which requires a lot of courage. So we identified that 45, 46 senior people sitting in Karachi, one day conference or meeting. And I initiated that. And that's what Dr. Iqbal was referring to, that Alhamdulillah, Allah subhanahu wa ta'ala gave me the tawfiq and the opportunity to be part of these initiatives. So we agreed on the problem, and then we said, okay, fine, what do we do? So everyone agreed that we need a national organization, because even at that time we had the Aga Khans and the Shifa and the Daws, which were doing a lot of research. But as a country, as a nation, we were embarrassed. We didn't have data. We didn't have national data of any disease. And all of those 45 people, including myself, used to go in conferences and sit quietly while our colleagues from Bhutan or Bangladesh or Sri Lanka were proudly presenting their national data. And we were like, so we are individuals, but when it comes to a country, so we decided that we need to establish a national organization, because this needs a national solution, a national initiative. It has to be a not-for-profit, registered organization. No one person, no one hospital, no one entity should own it. And that's how Health Research Advisory Board was created 13 years ago. And today, if you go to our website, inshallah, today I can proudly tell you that we have around 15 national disease registries. This is one of the biggest impact this organization and those healthcare leaders. So by the way, this was founded, the chairman was Professor Emeritus Dr. Abdul Ghaffar Bellu, who's the teacher of teachers, Professor Emeritus at Aga Khan, chairman of the department. He was the founding chairman, and I'm the secretary, I'm still the secretary. And then we had many, many seniors. So right now the board has 5 vice chancellors of the largest universities, Dr. Bali Khan from Indus Hospital, and Dr. Zafar, who was the previous minister. And all of us in the last 13 years, one of the things, and there are many, so I cannot go into that detail, but one of the major impact which we have created, and I'll give you a few examples. So 10 years ago, we started the first national disease registry of knee replacement, PNJR. It was launched at CPSP, College of Physicians and Surgeons, again strategically for neutrality. But only 7 centers from Pakistan, which means 7 orthopedic surgeons, agreed to share their data. And that too because, we convinced or begged them to do it. And they said, okay, fine, only 7. In 10 years, how many orthopedic surgeons do you think are sharing their data on this national disease registry? Take a guess. How many? Started as 7 are in Pakistan. How many orthopedic surgeons do you think are sharing their data on this national disease registry? For the country. Sorry. Less than 7. Around 165. That is the power. So, despite the fact that we live in Pakistan, if you start something meaningful, the first few years are difficult, but then you get the traction. More than 165 orthopedics surgeons and centers are sharing their data on this national registry on a software which Health RAB is running. And we have 10 annual reports which are published and shared globally, giving a good name to Pakistan as well. Started with one meeting, just like this. So never underestimate the power of one or the power of just one conversation.
Dr. Zaki, I'd like to make a point here.
Yeah, please.
You said you made a health research at IIT.
Yes.
But I feel you are collecting the data, but I feel there should be a part who can suggest implementation of that.
Yeah.
Because collecting of data is not important, but implementing the data for the general public is very.
Yes, yeah,
So
right.
You make a portion in this advisory board to implement the data.
I agree with you. And one of the conference themes for healthcare was implementation research, because we realized that there is a gap. And I'll give you a second example. So the second registry we started was in the space of cardiology. And Tabba Heart Institute in Karachi took the lead, Bashir Haneem, who's our founding board member. And we created the cath lab registry. Again, very more difficult than joint registry. Take a guess how many cath labs are now part of that registry. Now you can easily make a bigger tukka. More than 150 cath labs in Pakistan are part of this registry, alhamdulillah. So when you have the right intent, when leaders stand up and when they collaborate, I'm not talking about one champion, I'm talking about 5, 6, 7, 8, 10, 12 champions coming together humbly, collaboration with their, and obviously with strategy. We're going to talk about the strategy today.
And our communication.
Yeah, communication, and you get 150 cath labs connected. And now, as health rep secretary, when I'm giving the report, we have a registry in spinal surgery, we have a registry in hip surgery, hip replacement, and we have pediatric orthopedic registry, we have a diabetes registry, 4 registries in diabetes, we have a registry in gynae and ops, we have a registry in many different areas. And we just recently launched 4 new registries in ophthalmology and a few other specialties. So we are now launching, because this has become, now we have national data. So the first step is done, alhamdulillah, through collaboration, through trusted relationships.
Are we connected to international?
Yes, so the cardiology registry is part of the American registry, alhamdulillah, and we have won awards. Our spine registry was part of the Eurospine. So alhamdulillah, I'm happy to report that. So next question or comment, or we close here because we need to go to the session. So we have 3 more sessions, and the sessions have different themes. First one was just to build up the why we having this session. Now the second, third, and fourth are very focused. We're going to talk about strategic planning. What is strategic planning? We're going to talk about leadership. What is leadership? And what are the different models of leadership? And then the last session is about the global, and I've selected 7 habits. And by the way, so I conduct the workshop of 7 habits in 2 days. And today we're going to talk about 7 habits in 10 minutes. So that's why I need your undivided attention after lunch. Over to you, Khadima.
Thank you very much. So let's go ahead. And so we will go on a lunch and a prayer break, and we will be back in this room in 50 minutes by 2 p.m. The lunch is ready in the adjacent room for all of you, so please join us for lunch.
2 p.m.
2 p.m.
So for the online participants?
Again, 2 p.m. They can have lunch at their offices.
Yeah. So for the online participants, we will resume the session at 2 p.m. Pakistan time, which is in 30 minutes. Thank you very much.
So earlier, I would like to express my gratitude. It was a fantastic approach taken by you. And
There's also one support.
thank you. It was fantastic workshop. I enjoyed every minute of it. It's good.
Thank you. Thanks for that feedback. This is obviously very close to our heart. And this is part of new numerous sessions which we take on board with the intent that healthcare globally is kind of messed up, but more so in Pakistan, unfortunately. This is where we live. So we need to fix it. And we need to fix it. One way of fixing it is the reactive way, which is also important in times, because like I said, if I break my leg, it needs to be fixed. But that's not healthcare. Healthcare is more proactive, as we discussed. And that's where we need leaders to take courageous decisions based on very simple observations. So the example of Ignis and Hordman, I think that is really, if I can have the presentation, we'll खोल देंगे आप तो पुरानी वाली खोल दें जब तक लोग आ रहे हैं उसको रिव्यू कर दें. So, a few colleagues were discussing, we have so many challenges and people push us. And I said that this is exactly what I showed. Leaders are always pushed. तो अगर मैं उर्दू में शेर पढ़ सकूं, इसको मैं इंग्लिश में ट्रांसलेट कर सकूंगा किसी और का. तुम दिए बादे मुखालिफ से ना घबरा ए औकाब, तुम दिए बादे मुखालिफ से ना घबरा ए औकाब, ये तो चलती है तुझे ऊंचा उड़ाने के लिए. तो इसकी इंग्लिश है, वो है the kite of success flies against the wind of adversity, not with it. And this is the typical, the leaders thing. And that's where we see government. So leaders, against all the adversity, all the challenges, people push them, ostracize them, and they pay their price. But they always come back, they're resilient. Why? That's what we're going to talk about, which will come under the strategic plan. We're going to talk about mission, vision, goals, because leadership isn't complete without the conversation on mission, vision, and goals and values. So we will have that conversation. So just putting up, while we are waiting for our colleagues, maybe a few reminders on a few slides. So we saw that, and especially for those colleagues who are sitting at the back who joined us at lunch, different models of leadership across the world, and why we show these models, because we want to establish the fact that this is the global standard now. This is not something which we are creating. This is something innovation. We just need to copy those who have successfully implemented something. We just need to copy them, right? And everyone is doing it, like I said. So I think that's a take-home message. This slide, I think, is important. That what does the future 21st century healthcare looks like? This is what he or she needs to develop herself or himself in the areas. So the future healthcare professional has to be an entrepreneur as well. And he or she needs to understand innovation. This doesn't mean that he stops, practicing cardiology, but innovation can be integrated into the practice as well. So I think this slide is important, just as a reminder. And this slide is obviously very important, that this is what healthcare leaders do. At the end of the day, after all what we are learning, this is what we need to do. Wherever we are, even at our, homes, in our personal organizations. Safe and just culture. Learning organization for your family, for your kids. High reliability system, and the most important. I think this is a test. If I am not creating, or I have not created a leader, I simply do not have the right to call myself a leader. So I think this is important. This slide was important enough. So can we start? Just to tell me. Can we start? Okay, so I'll change the. So yeah, a few of the leaders. And as I said earlier, please take notes. Take notes of the people I'm mentioning. Like these are जैसे अलग ही दुनिया के लोग हैं ये लोग visionaries. They can see beyond 30, 50, 60 years. Secondly, number two, yes. Thank you very much. So, formally, आवाज जा रही है? कुछ वहाँ पे सब जा रहा है. So, Bismillahirrahmanirrahim. Assalamu alaikum. And welcome back to the second session. And again, please help me to take this session quickly forward, which means that I have to have your undivided attention and focus. And while you are focusing, please write down. I request you again and again. So we have established the need for leadership in healthcare after doing the situation analysis. Now we want to understand what leadership is and what do we mean by leadership and the styles. So John Maxwell, again, was a very, very short session, So what I'm covering today, these are like 4, 5, 6, complete workshops. So I'm just giving you a summary of that, right? So the single biggest way to impact an organization is to focus on leadership development. Period. Khalas. If someone has doubt, because a lot of people think that this is a waste of time, it's a luxury. Leadership, development, capacity building, CME, this is a luxury, especially for Pakistan because we have so many patients to treat. I do understand that we have so many patients to treat, but we are treating them inefficiently because of our systems issue. So, what is leadership? I want you to think, what do you think is leadership? Define leadership to yourself, and write it down in 1 minute. I'll give you 1 minute. What do you think is leadership? And then I show you and you can compare and align your thoughts with what we see here. Or what is your definition or understanding of leadership? Or who is a leader in your, thinking? आप लोग अगर आगे आ रहे हैं क्योंकि वो देखने की वो चीज नहीं होगी फिर आप पर अगर जगह है ना हमारे पास फाइल है ये 3-4 लोग शायद 3 लोग आए बाद में तो अगर तुम and whoever doesn't have anything to write, please ask. The team will help you. So you get some of you have written what you believe is leadership, right? And keep it to yourself. Okay. Now, just read this. So Stockwell actually did a kind of a meta-analysis, right? There are almost as many different definitions of leadership as there are persons who attempted to define the concept. So the first thing is there is no definition of leadership. It's not a third law of Newton. There is not. You can describe, define, and I will show you how others have done it. So summarize. Venice estimated at the end of the last century at least 650 definitions of leadership in literature. 650 different ways people attempted to define something. So this is not a simple trait, right? And then Kellerman commented, I heard that there are approximately 1,400 different definitions of the words leader and or leadership. So we established that whatever you have written is fine. Whatever you have written is fine or could be fine, but we'll see what others have attempted. So Confucius, right? A lot of people think that he was a prophet, right? So for Confucius, leadership is to serve people. This is how he defines or describes. For Plato, leadership should be, so he's a wise person, so he thinks leaders are wise people, right? So and I'll just now skim through it. So please just read and get a sense of how everyone has attempted to define leadership. Intelligent to have the support of the people, a great man. This is where the charisma comes in, like a leader or, charisma. Even if I'm not wise, even if I'm not serving, even if I don't have character, but if I have charisma, some people think leadership is charisma. Stockdale actually, for the first time, defined it as a process. So leadership is a process, and we'll look at it later as well. Influence in leadership came into the definitions. Process of moving a group, fine, we all know that. Interaction, process that could be influenced by anyone. That is something interesting. By anyone. Then again, follower-centric approach, importance of the leader setting of vision. So now see, achieve some common goals. Only definitely someone that has followers. Now this is very interesting. And Peter Drucker is the guru of management of our times, right? So by this definition, Hitler is a leader, right? Hitler, Stalin, Mussolini, and even our dear friend Trump. Thank you. Even our dear friend, anyone who, according to him, if you have followers, you're a leader. So there's no right, there's no wrong. There are different thoughts behind leadership. That's why I've gathered all of these different, so that you start thinking yourself. Don't just follow a definition. Don't follow one definition blindly. Think about it. I don't agree with this definition at all. I may be wrong, I may be right, but I know at least have, the clarity, this is, according to my understanding, this is not the right definition. But I could be wrong. But at least I have a stance. So please think like that. So let's try to define. So I've kind of summarized the definition. So first would be the ability to influence a group towards the achievement of goals. I think pretty decent. It's a pretty decent definition. Art of motivating a group of people. So replacing influence with motivating to act towards achieve common objective goals, objective, same thing. And then I would attempt to summarize or make it more comprehensive. According to my understanding, my belief, my ideology, my bias. How many of you think that you are not biased? आप biased नहीं है? Anyone else? आप biased नहीं है? आप भी नहीं है biased. Okay. So मेरा भी ये ख्याल था. So I also thought that I'm a pretty objective, I'm a very smart guy, I look at things objectively, very categorical, and I don't think that I'm a biased person until I learned unconscious bias and then became a certified trainer of unconscious bias. And then I saw the slide. If you have a brain, you have a bias. Because a bias is a physiological thing in our brains. So so I was with you maybe a few years back. So this is the summary. Leadership is the process. Number one is the process of interactive influence. So the follower also can influence the leader. Keep that in mind. Again, brings humility. Right? This macho man, this is one way. When in a given context, please remember this one, given context. Some people accept someone as their leader to achieve common goals by respecting and valuing each other. Now, again, like I said, my biases are behind this definition. You may agree with it, you may not agree with it. But keep a few things in mind, given context. Why do you think context is important in leadership? And I'll give you an example. Okay. In the interest of time, unfortunately, you can imagine this could have been a very interactive, longer conversation. But I have to ask the question and I have to answer it myself because of the constraint. Fatima Sahaba, give me more time next time, please.
Yes.
Inshallah. Okay. So, Winston Churchill, remember Winston Churchill, who led Britain in the World War II as winners, and Churchill was a hero. Yes. So he was a leader for the British people. Winston Churchill was a leader for British people. 4 months later, 3 months or 4 months, in the elections, he lost. Does it make sense? Yes and no. How can he be the hero and the leader and then lose elections? Context. Because the British people knew that this Churchill is a hero in wartime, not in peacetime. That's why context is so important. Good example, a very good example of how, mature nations select their leaders. So let's move forward. We all know the difference between leadership and management. So no need to have, conversation on this, but just had to show this to all. But this is the million-dollar question. So how many of you think the leaders are born? How many of you think that leaders are made? How many of you think that leaders are born and made? Right? So at least we all agree that leaders are not only just born. Because if any of us believe that leaders cannot be made, then why are we having this session? Right? Then this session is, unnecessary, because if we believe that leaders cannot be made, then we should not have this session. But we also realize that some of the leaders are also born and some are made. So that's a good mix. So these are the two theories. So the previous theory was trait theory. I'm born, you're not born, you cannot be made. Khalas. Right? Then we realized, so leaders are born rather than made, charisma. So please keep in mind the paradigm. People who follow the charismatic, leader believe that leaders are born. Because where am I going to bring the charisma, right? But the behavioral theory said leaders are born, right? And then we look at the transactional leaders and the transformational leaders. Even without going into the details, the terms, these are the two terms, transactional, transformational. What does it mean to you? So let's say I have a transactional relationship with you. What does it mean?
Give and take.
I want something from you,
Yeah.
and I'm going to give something to you. Khalas. And if I have a transformational relationship with you,
you won't be expecting anything in return.
I may not. So it's a heart-to-heart relationship. It's a heart-to-heart. In transformation relationship, you are important. In transactional, your car, your status, your money, your position, something you possess is important, right? So we live now, fortunately, in the transformational leadership era, or we should. I shouldn't say that we do. We should focus on, because this is idealized influence, inspirational, intellectual stimulation, etc. Again, you can see that I'm going a little, quickly. So characteristic of transactional leadership, contingent management. So let's move forward to the transformational, right? This is how we define transformational. But the crux is that in the transformational relationship, you are important for me. Keep that in mind. And there's a relationship, heart-to-heart relationship between two people or a group of people. So you matter to me. And I matter to you. I'm important for you, not my position. Okay. So transformational leaders in healthcare. So we work in patient safety, we work in quality. And let me give you one more example. So at the last Arab Health is one of the largest events in the world. It takes place every year in Dubai. And every year we have a quality and patient safety conference. And I'm also invited to speak there, and there are a lot of other speakers from all over the world. So I'm giving you an example. Johns Hopkins, the name comes up whenever you talk about quality and patient safety or best hospitals in the world. Johns Hopkins, US comes up again and again. Yes, we all respect Johns Hopkins. So the director of Johns Hopkins, the director of quality and patient safety, was also one of the speakers. And by the way, Johns Hopkins is leading the quality and patient safety journey globally for the last 25 years. Hans? Yeah. So the director of one of the best hospitals in the world of the quality department is speaking at this big conference. And you know what the title of his talk was? The needle is not moving. What does it mean? Eh?
Mindset is not in.
Less improvement,
That's pretty much the same thing.
less improvement in any particular area.
Improvement is not happening.
Still-
Still stagnate, still patience, or remember what Professor Lucian said? We haven't figured out. Professor Lucian, Professor Emeritus, pediatric surgeon at Harvard, again had the humility and the courage to accept something that I'm sorry, I'm failing. I'm sorry, I'm failing. Not the arrogance that, the example I gave that defined the security guard of comstech. And I report back to you, sir. Sir, in the last 1 month, only 17, thefts happened, and I'm looking for a raise. This is healthcare, right? So the director of quality department at Johns Hopkins came and he spoke about the needle is not moving. Why is the needle not moving? One of the biggest reasons is leadership culture. Because we don't have the leadership to create the just culture and systems, if I can just connect the three. And that is why we are having this conversation today on healthcare leadership. Because despite 25 years of extensive research, extensive training, interventions, technology, we are still struggling. Patients are still dying every day and are being harmed every day. So that's why we need transformational leadership model, where we have relationships, where we trust each other, and we're going to talk about that later. I'm just giving you a kind of a backdrop of this, right? Culture of open communication and continuous improvement. All what we're going to talk about culminates into that, the culture of patient safety. And so good leaders have the ability to inspire us in their lifetime. What do great leaders do? Good leaders have the ability to inspire us in their lifetime. Sorry?
Change you.
Great leaders beyond their lifetime. Look at all the prophets. Look at, Prophet Muhammad Sallallahu Alaihi Wasallam, look at Jesus, look at Moses, look at Gandhi, look at, any of these great global leaders, other than religious leaders. They're, Nelson Mandela, look at this guy. Unbelievable. How many years did he spend in prison?
5 years.
See?
5 years.
27. Unbelievable. So, great leaders have the ability to inspire us even beyond their lifetimes. And that's what Simon Sinek said. So please read Simon Sinek as well. Note down his name. And I will talk about him in the next session as well. Okay, so tell us about yourself means tell yourself about yourself. A leader who inspires you and why is it so? I want you to ask yourself, who is the best leader in, in your opinion and why? 1 minute, write his or her name and the reason why you think he or she is the best leader for you. 1 minute. Okay. And just keep it to yourself and then come back to this, especially the why. So, for instance, if you think that Hitler was your inspiration leader, and if you think that you love the way he used to salute, reflect back on this. Obviously, I'm sure that, and that's why I selected this example. But come back to the why behind why you selected someone when we're done with this session. So, there are plenty of traits and qualities of leaders. So I love John Maxwell's 21 principles of leader, but I don't have time to talk about those. But I can talk about this. And why? Because this, as you can see, was published in Harvard Business Review and it became very famous. And these are just 4. So that's why I selected that for today. Otherwise, I would have spent 15-20 minutes on the 21 models, maybe later, inshallah. So let's talk about this. These are the 4 unique qualities of inspirational leaders. According to Garrett Jones in this Harvard Business Review article, very famous article. Number 1, as a leader, reveal your weakness. Show you're human, right? You're not a Superman, right? You can get hurt, you can cry, you're a human. Second, become a sensor. Leaders can sense, they have intuition. They're kind of a gut, right? A lot of people are very, very in life, very evidence-based. Give me proof, otherwise, and there are others who say, no, I think I'll go with this. Proactive or practice tough empathy. Give me an example. Give me an example of practicing tough empathy. Who practices tough empathy the most?
Physicians,
The
I think physicians.
physicians
And some
and
surgeons.
surgeons.
As an example, Mother Teresa.
So my answer is parents. My answer is that your answer. Thank you. Parents practice tough empathy. So just, he's my son. I love him. Right? But I'm going to give him what he needs, not what he wants. So if he's going to ask me for cigarette smoking, I'm going to say, sir, I'm going to give. Tahir, no sorry. So Tahir, I love him, I empathize, but tough, no sorry, no sorry, no sorry, no sorry. Leaders do the right thing. Politicians do the popular thing. That's why our politicians are unfortunately not leaders. Because our politicians, or sometimes even us, so look inside, let's all look inside, right? Sometimes we all take the popular decision, not the right decision. But leaders take the right decision, even if it is not popular. So leaders practice tough empathy and they dare to be different. They dare to be different. Just like entrepreneurs. So this article, summarizes these four, but then again, as you already know, we can talk about a lot of other qualities and we will. This was just one. This gives us a different perspective, especially this one. Practicing tough empathy. And this breaks the macho, right? In Urdu, we say hato bacho. Leaders are also humans. So let's move. This is Jim Collins. So Jim Collins wrote the first book was Built to Last. Was the first famous book. I'm not talking about that. But then he went on to write this another great book. And he talked about level 5 leaders. And this is the window and the mirror. Just remember the concept of window and mirror. Level 5 leaders look out the window to give credit to. So if I'm leading Health Research Advisory Board. If something good happens, the credit goes out the window to my team. Window. If something wrong happens, the mirror, I take responsibility. This is the level 5 leader. If we are successful, I look outside the window towards my team. If we fail, I look at the mirror, I take responsibility. I'm responsible. Another model, this is the Stephen Covey's model. 7 Habits Stephen Covey's model of leadership. Please note trust at the center. And I want you to note that all these brilliant visionary leaders, they keep important things at the center. So yes, strategy, yes, coaching, yes, vision, and trust at the center. They inspire trust, they create vision, they execute strategy, and they coach potential, which is capacity building, helping their key members. So we all know about emotional intelligence. Daniel Coleman talked about it most, and we know empathy is part of emotional intelligence. And we also understand that leaders have to have this quality or a skill in them. This is as it's written here, the sine qua non of leadership. You can't be a leader if you're not emotionally intelligent. Even if you have an IQ of 160, which Einstein was claimed to would have had, you cannot be a leader. So Ignas, remember Ignas, our friend? Unfortunately, Dr. Ignas, who was ostracized, did not have emotional intelligence, but Codman had it, right?
Now let's look at the third intelligence.
So let's move empathy. We all know what empathy is, but I want to have you focus on something else, not on empathy only. As healthcare professionals, and what is that? Any guesses? जी? हाँ वो तो हो गई. Compassion. So I want to take your focus away from empathy to compassion. This is a take home of this session as well. So what is empathy? Empathy is, as you all know, putting myself in your shoes, right? That's empathy. Alas. What is compassion? Compassion is simply, you can read the whole slide, but in one word, compassion is empathy plus action. Period. Compassion is, it has a mathematical equation. If I can write down here, compassion equals to empathy plus action. But there's a huge difference between these two. And we'll see it here. So when we show empathy and when we show compassion, healthcare professionals are required not only to show empathy, but show compassion. And there's again a physiological basis behind it. When we show compassion, our reward center in the brain gets activated. And we feel a high. But when we empathize again and again, we get depressed, or we may get depressed. And that is why physicians are trained between the lines, not to get too attached with the patients. One of the reasons is because if you empathize with them, especially the depressed patients, you will start feeling bad. But compassion has this brilliant side that when you show compassion, the reward center of your brain activates or is activated, and you feel good, not depressed. So this is very important. And leaders do not stop at just empathizing. They go a step forward and they show compassion. So that was the message which I wanted. So compassion and leadership. So I published a paper on compassion and leadership in PMJ, where I talked about the link between these two. And again, I think up until 4 years, I had no idea about the significance of compassion. I actually thought that compassion and empathy are the same thing. Up until 4 years, I did not know these are two separate things. And I had not read the book, after which I realized that, God, this is a completely different beast than empathy. And there's evidence and there's physiological basis for compassion. And hence, quality and patient safety gets improved through that. So we'll stop here for the second session, and we'll immediately move to the third. But before that, again, Samra, any questions related to the theme which we covered regarding the definition of leadership and then the later part of compassion? Any questions or comments? Anyone? So we're okay? No comments, no questions, very good. So we make good time. Unfortunately, we are not taking questions from our online participants who are actually huge in number, but we are not taking questions. Oh,
So if you want, I can read some questions.
yeah, the chat is filled with 99. So Khazima Sahaba, if you can summarize or look at, maybe a few questions which you think are important. So our participants who are online, we are going to, so Ms. Khazima is going to look at, the questions or remarks, and then, she will help us with that. So we move forward with the third session. We have to be cognizant of the time as well. The third, Aruj Arshad raised a hand. Wow, this is brilliant. I'm really happy to see so much interaction from our online participants. But I'm really sorry, based on the time constraint as well as maybe we just missed out. There were so many 99 comments and questions were there online. So I apologize and I take responsibility for that.
So I'll take some questions which are posted here.
Okay.
I think some of them, they also relate to the session number 1 that you gave in the morning.
So while you're summarizing or capturing those questions, we can start the third session in order to.
Okay.
Yeah,
Okay,
because
right.
that will take time.
Okay.
And we need to,
Right.
take the, yeah, so as I said, Ms. Hazima will be looking at the 99 comments or questions. And she will summarize, and then we will answer hopefully as many questions as possible while we start the third session, which again is extremely important. And that is a session on strategic planning. So, thank you very much. So let's start with the strategic planning session. How are we doing with time?
We're already 2:45 and I have virtual of the program. Yeah.
1 hour 20 minutes.
Okay, so let's move quickly. So this is where we look at the personal leadership. And as I said earlier, if you want to be a leader, you cannot miss this. This section is very important, even if you want to miss the last one, but this is this talks about the personal leadership stuff. So the strategic planning for a meaningful life, what does it mean? It means that you have to have these four for yourself or for your organization. But first, you have to have these four for yourself. So how many of you have sorted their own purpose or mission? You have sorted that, very good. How many of you have a vision for yourself? Okay, let's not show hands, but ask yourself and write down. Do you have your purpose sorted? Purpose and mission are the same thing. Do you have a vision for yourself or for your organization? Do you have goals? And have you sorted your values? So we're going to talk about these four. This comprise, although there are some other things as well, like SWOT analysis, right? But we will focus on that. So let's start with the first. And let's see what strategy means. As again, it's a Greek word. The art of general plan to achieve one or more long-term or overall goals under conditions of uncertainty. Okay, I don't know if that helps or not. But let's jump to strategic thinking. Strategic thinking is a mental or thinking process, and leaders need to develop this skill. This is not a quality. This is a skill of strategic thinking. Applied in the context of achieving a goal or set of goals, intentional and rational thought process, etc., etc. Just read, and then it forces you to more closely examine why things are being proposed and pursue instead of just what is to be done. So strategic thinkers or strategic thinking shifts your thinking process from what and how to why, which is the $1,000,000 question. Remember, when we started the first session, I asked each one of you, why are you here? So let me give you an interesting incident. So I was conducting a workshop just like this, and 25, 30 professors are sitting in the audience, and I committed this mistake of asking, why are you here? So a very senior professor raised his hand, and you know what he said? He said, I'm here because the vice chancellor asked me to be. He had the audacity or the arrogance or maybe the honesty to convey to me that I'm not interested in what you're talking about. I'm just here because I was asked to be here, so I'm here. So that's why I'm not going to ask you, so that I don't get the similar answer again, right? So now again, please put yourself into this and ask yourself, do you do this or do you do this? What is your default? How do you think? Do you have a broad view of things or do you narrow down on things? That is called tactical, right? That is a tactical level, and that is the what and the how, and the broader is why. So I'll move through it, just read it. Now, in order to explain this, I have created the scenario. So I have two managers. One is Aisha and one is Noor. Now just look at how these two behave. So Aisha has keen interest in the mission, vision, values, and strategic objective of my organization, while Noor is always interested in her own needs and wishes. Aisha leads her journey with the organizational strategic plan, while Noor studies her own JD and TORs and focuses more on completing her own tasks to become more efficient, which is good. But that's the narrow focus. Aisha is looking broad. She's also interested in the organizational goals, not limited to hers. Aisha writes down goals which push, support organizational purpose. Noor develops goals which align with personal development and gains. Aisha engages colleagues and other team members. Noor doesn't spend time with other colleagues or helping team members to succeed. And by the way, she may be promoted and she may be getting a very good salary because she performs. Keep in mind that she delivers and she performs as well. But what we're trying to demonstrate here as a head-to-head comparison and also in the next slide is that Noor will always remain a manager. And she may be a very good manager. But she will not be seen as a leader. And even if she becomes a leader, she will become a transactional leader. Make sense? She will become a transactional, so she will become a CEO, but then she will be a transactional leader because this is how she thinks and operates. While Aisha is a transformational strategic leader, right? Make sense? So where do you see yourself? Hopefully here, even if you are here, sometimes here, because obviously, no one is perfect. But now you have a comparison that if you think that, oh, I do this 3, I do 5, I do 7, and then I do 5 here and I do 8 here. So you can always shift to the left side, right? Okay. So strategic planning is viewed as a process for determining where and how an organization needs to move over the, this is about the organization, right? And then we get a strategic plan. So these are the steps. So first, the most important, the $1 million, sort the why for the organization, for yourself or for your organization or for your family or for your group, for your NGO, sort the why, sort this. Then the what and when is the vision and the goals. How is the, the sort, the relationships, and then where do you need to go? That's the circle of influence. So this is how I have created, this is the model I've created. It's a very raw model of the strategic plan. You start here, what is your ideology or a set of beliefs, right? Then what is the purpose? And we will talk about what purpose. I'm not defining these yet. I'm going to define them, right? And then this is all is why. And then you say, okay, how do I do this? But before you ask you how, you look at where you want to reach. So, for instance, my mission is to please Allah subhanahu wa ta'ala. This is the purpose or my ideology. And to fulfill my mission, I want to open up an orphanage for free. How do I reach there? Is the how. Passion, values, and I focus on my circle of influence. And I'm going to talk about that in the fourth one. What is circle of influence? Simply means that if I have to open an orphanage, probably I'll open it in Karachi because I live in Karachi. I will not go out and open it in Singapore. That's not my circle of influence. That's my circle of concern, and we talk about that, right? So this is how you develop a strategic plan for yourself or for your organization. First, you need to sort the purpose, the why. And then where do you want to go? And once you know that, okay, I want to go to Islamabad for this reason. I want to go to Islamabad, that's vision and goals. Why do I want to go to Islamabad is this. How do I go to Islamabad is my strategic plan. Okay, so the deliverables of the strategic planning process are these. And we're not going to discuss this because we don't have time. This is how this matrix looks like. At the center is your ideology. the right and the wrong, your belief set. This is the number one purpose, mission, an individual's sense of why or organization's sense of why. Once you have sorted this, you create your vision and goals here, and based on your values, you reach that. I've shown you this. So let me give you an example about the purpose and mission. We call it the raison d'être. In French, it is called raison d'être. You know, why do I exist? Why does your organization exist? You are from Hamdard, right? You told me. Why does Hamdard exist? I'm not asking you about your vision. Vision is something else. Why do you exist? Why does comstech exist? The raison d'être, the reason, the purpose of existence, that's mission. And let's see what it means. So I gave you a story of Ignace and Corbin. I'll give you the story of two people here as well, because that helps us to make our point. So this smart guy is Samuel Langley. Ring any bell? Do you know him? Have you heard of him? Have you read about him? No one has ever heard of this guy. Yes? Me neither. I hadn't, because I know this is the case. Otherwise, I don't know who he is. So Samuel Langley had a $50,000 grant more than 100 years ago. He had the best of the minds, or he has gathered because he had the money. So he hired the best minds, and he had the best office, he had the best computers, which didn't exist at that time. So he had the best whatever existed, because he bought everything. And he had contacts, wasta, right? And his why was, he wanted to make money, he wanted to be famous, and he wanted to be successful. By the way, this is not, haram, right? I'm just trying to make a point here. But now do you know what Samuel stood for? Now look at the Wright brothers. How many of you know Wright brothers? Everyone, right? We all know them. So let's look at them. Government funding? None. Team? That's these simple guys and maybe a few friends. Material? Just from their backyard, right? Connections? None. Why? To develop a technology to change the world. Now, to compare the why, all of these compared. Simply because, and yes, I do understand that I'm perhaps oversimplifying it. I do understand that. And that's the caveat in this, right? I do understand that, but I'm trying to make a point here, but because we do know that all of this is correct. These two brothers who had their why at the right place, despite the fact that they didn't have any of this, and this guy had $50,000 extra, they were able to change the world because they wanted to change the world. They didn't want to make money, although they did make money. That's what Jim Collins said in his book, Built to Last. That companies which exist, organizations which you are creating, Hans, organizations which exist for 50 to 100 years, do not exist to make money. They exist to create value, but they do make a lot of money. But they don't exist to make money. That's what Jim Collins, who is part of the US, the mecca of capitalism, after 4 to 5 years of research in the US, inferred that these, and I can give you an example of Sony, but as a matter of fact, I think I'll give you an assignment. Look at how Sony was founded, and you will understand this concept. The founding document, the founder who wrote that document does not mention that Sony is founded to make money or to give profit to the shareholders. And this is the era, this is the post-World War II era, when Japan is not only destroyed, but it is embarrassed in front of the world. So because for Japanese people, they would rather commit suicide or die than surrender. And the Japanese had to surrender. So they were extremely embarrassed. They were extremely with low self-esteem and confidence. And in that era, this strange guy comes up with this premise that I want to establish a company which does this, and you can look it up on Google. And he doesn't mention that I want to make a lot of money, although he did make a lot of money. So making money obviously is not bad, right? But existing to just making money may be bad. So that's why they become, and the final test was, as soon as the Wright brothers became successful, our friend Langley just stopped the project. Because his why was not to help the world. He wanted to be the first and the famous. So as soon as he lost this opportunity, he said, fine, back up, let's do something else. And that also tells us that his why was not in the right place. So this is the power of why. And I've given you the example of Sony as well. There are many other companies and organizations whose why is so strong that they become the Ahuats of the world. You know Ahuat, right? Ahuat is the world's largest interest-free microfinance, started in Pakistan by 1 or 2 people. And now it is the world's largest interest-free microfinance. Because the why was set. Sorry. Okay, so they started with their why. So that's why we, yeah, sure. Thanks for coming. So that's why we need to start with our why. And we started with our why in this workshop as well. The golden circle. This is Simon Sinek again. So Simon actually wrote this book, Start with the Why. It's very famous, young, relatively young guy. And this will tell you about the why is your purpose. Just look at it. Yeah. So this is an exercise which we want you to do in your own time, not today, because we don't have time. But write down your roles, and then your responsibilities and relationships. 1, 2, 3, 4, 5. So your role is what is your? Just give me one role. You are a teacher. Role. So your one role is teacher. Your role.
So mother.
You are a mother, right? Role. Supervisor. Role.
Researcher,
Role.
actually multiple roles at the same.
We all have multiple. That's why I'm asking each one of you your role.
I'm director
No. Okay. So are you a sister?
I'm a researcher, I'm a mother.
Are you a sister?
Yeah.
Are you a daughter? Role. Role. Huh?
Researcher.
Now, some of you all are biased towards your professional roles. I am not asking about your professional roles. I'm asking about your life roles. Life roles, right? So please, so you are a father, you are a son, you're an employer, you're an employee, right? You're a leader, you're a follower, you're a brother, you are everything. Write those down, and then your responsibilities. If this helps you to come up with your why. Why do you exist? So a mission is a powerful document that expresses your personal sense of purpose and meaning in life. Meaning. Maqsadiyat. Meaning in life differentiates us from animals. Because animals don't have a meaningful life. Human beings should have a meaningful life. There must be a purpose or a meaning or a maqsad in life. Whereas vision simply is picture of the future. So let's move towards vision. See, this is vision. Vision is simply a picture or image of the future we seek to create. Based on our, see, based on our, I want all of you to say this because this is confusing. Vision is the picture of the future based on our purpose, our mission, our why. I'm repeating. Vision is the picture of the future based on our purpose / mission / why. And this is another great thinker, Peter Senge, great thinker. And look at what he says. Linking vision and purpose. Real vision can't be understood in isolation from the idea of purpose. Vision without purpose is baseless. So for a good vision, you have to have a good base of purpose, right? And by purpose, I mean an individual's sense of why. Why do we exist? I'm spending more time on this because this is the most critical point for leaders. Leaders need to know their why, not their what. They can have 10 managers to sort the what. Then values, right? Sometimes we call values as principles, but principles obviously are slightly different, and values are relative. So, just an example, these are let's say my values. Your values could be different, or we can have an overlap as well. These are called values. So, organizations create their own values. For instance, your organization, Hamdard, does it have this excellence as a value? So when you have excellence as a value, then you will not settle for less. If I come up with an assignment which is good, you will say that Dr. Zaki, this is good. It's not excellent. And in our organization, we aspire for, so he will send me back. And this is how he, as a leader, will create the culture of why. On the other hand, if we don't value this value, whatever I bring, that will be good enough for you. चलता है सब चलता है टेढ़ी लाइन भी चलती है. Do you understand now? So if your organization has this, again, fairness. So for instance, I'm the CEO of a hospital and you are my top surgeon. And he brings the maximum revenue for my hospital. Maximum revenue, and he's the most famous surgeon in Asia. And he commits something, and that comes to me. If fairness is a value of my organization, I will have to fire him. Yeah. And if I don't, then A, fairness is not a value, and second, I am not a leader. Not a leader. Right? Because leaders do the right thing. Politicians do the popular thing. So the popular thing is keep him. So I'm not a leader, I'm a politician. Okay? So I'm not going to talk about the others. So what do you think is the most important trait of a healthcare leader? जी आपके ख्याल से हाँ compassion, okay. आपके ख्याल से आप ही को कह रहा हूँ. What do you get सामने? What is the most important trait of a healthcare leader?
Definitely compassion. Actually, I didn't belong to healthcare sector. So
Which sector do you belong to?
basically, I'm fond of scientific Pakistan and I'm a leader also.
See?
I'm fond of I'm a researcher basically and a research trainer and a fond of scientific Pakistan. I'm here to understand the concept of leadership.
चलें, great. जी आप बताएं.
Vision.
Vision. आप clear vision. हाँ, clear vision. Empathy. Integrity. High values. High values.
Yes.
So, लेकिन ये ध्यान में रखें, this is NHS, so it's not ultimate. So, NHS did a survey, and the result was that most of the people thought emotional intelligence, which is empathy, is number one. Second is integrity for them. But if you ask me, integrity, like you, is number one. Third, listening, communication, trust, and then authenticity. So for NHS professionals, these are the 5 top traits for healthcare leaders. So, but the Franklin Covey survey said integrity is the number one trait. And we'll see why. So Mayo Clinic, remember I talked about Mayo, right? So Mayo is considered as a value-based, very forward-looking, organization. So Mayo can that patients' needs come first, and they practice, what they preach. So they walk their talk. They walk their talk. So I'll not explain this. I just want you to just read this, and then I'll move forward. So this is the walk the talk, walking their talk. Okay. So the foundation of leadership is trust. And you know what trust is. How do you build trust? Give me one pillar which trust stands on.
Transparent communications.
Openness.
Anything else? Commitment. Commitment. Anything else? Yes. So, integrity. Integrity builds trust. Khalas. So, if you remember Prophet Muhammad, even before he was made the prophet, he was known as Sadiq and Amin. So his integrity was established in the society even before he was proclaimed or he proclaimed himself. Integrity, without integrity, there's no leadership, right? Okay. Integrity builds trust. So dimensions of trust, we'll talk about that, what builds trust. I wanted to talk about these two things, character and competence. Sometimes people think that only this is important. So let me ask you, would you like to go to a surgeon to get your mother operated who has very strong character, but he's not competent? No one would want to go to a surgeon who is not competent. And without competence, you cannot create trust. So I wanted to talk about these two things more specifically, right? Character and competence. So now let's talk about goals. Please remember that mission and purpose is something else, vision is something else, and goals/objectives. Because sometimes some people call goals objectives and some call objectives goals. So we're not going to go into that argument. Let's just accept that goals and objectives are the same. So goals give momentum to your mission and vision. Once you have sorted your mission, once you have sorted your why, then you sort your vision, and then to give momentum to your vision, which means how do you achieve your vision? You create small, short goals, right? So goal setting is a powerful process for thinking about your ideal future. And we all know SMART goals, we've heard of it, right? SMART goals, specific. So we all know that, right? We all know that, right? Okay. So yeah, I'll show you this study. This is a very, very interesting study, and which goes to show the value of goals. So they did this study many, many years ago in '79, and the MBA students were asked, have you set clear goals? Only 3% of the graduates had written goals. only 3% had written goals. 13% had goals, but they had not written their goals. And the remaining whopping 84 said, we don't have goals. So these are MBA students. 84% of those MBA students and 79 said openly and honestly that we don't have goals. So I would like to ask you, is anyone in this audience and my online participants as well, and please write that down, and Miss Khazima will capture that. Do we have someone who has actually written their goals for the next 1-2 years? Anyone? You have written personal or organizational? Organizational. I'm at also organizational goals, obviously, all organizations pretty much. I'm talking about personal goals. Because organizations, pretty much every organization has goals. Has anyone written their personal goals? And this is you, mashallah, congratulations. So you are actually part of this 3% or a very small minority. But if you look at the second part, 10 years later, the members of the class were interviewed again. The 13% of the class who had goals were earning an average twice as much as the 84%. But look at the 3%. Aapka naam kya? Yasir. So look at the Yasir Alis of the MBA program, right? People like Yasir who had goals, who not only had goals, but had written down those goals. Look at their success rate. They were earning on average 10 times as much as the other 97% put together. Simply writing your goals. Simply writing your goals creates in your mind this feedback, and you start believing in something which you have written and when you read. This is the power of the brain. Although it seems, sometimes superfluous or unnecessary, it's a waste of time. Why should we write goals? I know my goals. But when you write your goals, you become part of this 3%. So are we going to have goals and write our goals from today, inshallah? Inshallah. Okay. So the goal setting process, I'll just okay, I have to stop this third session because the fourth one is also a longer one. So I've given you the idea of goal setting. You believe in yourself and faith and start small, baby steps. We call it baby steps, easy, and then you'll reach there, inshallah. This is the SWOT analysis. I think all of us have done this in our organizations, but leaders do the SWOT analysis for themselves. So how many of you have done SWOT of yourself? You have done SWOT for yourself? 1, 2. So you know your strengths, you know your weaknesses, you know the opportunities and threats around you. Brilliant. You too, right? Okay, and this is the famous 6-step process. Number 1, the first thing, connect to your why. Second, review your roles. Remember, I asked you to write down your roles. Remember, this is how important it is. Third, identify your goals. Then organize weekly. Review everything, whatever you've written on a weekly basis, because month is too long and a day is too short, right? And then, what is exercise integrity? This is discipline. If your goal is to lose weight, to, let's say, walking or dieting, then you have to exercise integrity. No soft drinks. Remember, I am dead against soft drinks. Dead. And this is my bias, if you may. And I'll keep bringing the soft drinks in the conversation and again. Okay. Does anyone remember this? The Columbia Space Shuttle incidents? You know what happened, right? This crashed, all of them died. And after this, they actually stopped the NASA program. The program was stopped. Why do you think they crashed. So, if something so big happens, these learning organizations, live organizations, they do root cause analysis. They want to find out what really happened. What do you think happened? What do you think was the reason behind this big, embarrassing clash?
A starting point piece just to wipe out during the launch time, just wipe out the heat shield from the space shuttle. And while it was re-entering the space, that small hair size hole got so enough due to the heat that it just wiped out the whole heat shield from the planet, and it got shattered within seconds. And all of the crew was burned. Like
Yeah, so what you're telling me is kind of like a patient telling me that he has fever. I'm not looking for symptoms. I'm looking for the real why. What really happened? So thank you for sharing that. Actually, I didn't know that, right? But that was the evident, maybe, cause. What really happened behind?
Lack of foresight, maybe.
Maybe like, so NASA did a root cause analysis, a deep one. Not looking at the fever or pain, these are symptoms. What is the diagnosis? So the NASA report blames flawed culture in NASA, in the organization of NASA. Culture. Did any of you even imagine that the reason behind this embarrassing catastrophe would be culture? Whereas you gave us the apparent reasoning. But NASA, after completing its complete report, humbly, with courage, said that the flawed culture of NASA led to this disaster. Why am I showing this slide to you? Because I want to emphasize the significance of culture. Why culture is so important. And who develops culture? So, in the culture in your organization or your department is developed by you as the leader. In my organization, and Hamdard in your department, and all of us leading our departments or who are your organization. The culture, it's your responsibility to develop the cultures. Culture of excellence or culture of mediocrity. Right? It is your responsibility, it is my responsibility. Culture of mediocrity or culture of excellence. Think about this. So, Peter Drucker said, culture eats strategy for breakfast. So I told you about the strategy. The whole session was on strategy, right? This is a anti-climax, I would say. I was speaking about strategy for the last 30 minutes and how important strategy is, what strategy is, and then I come up with this. Why? Because if we only focus on developing strategies by paying McKinsey $10 million, McKinsey can come up with a brilliant strategic planning document for comstech, right? And charge $10 million, a brilliant document. But the culture in comstech, I'm giving examples, will eat that $10 million document. So what is bigger? Strategy or culture? Culture. Culture. That is how powerful culture is. So I wanted to make that point, before we stopped talking about strategy. Strategy is extremely important. Mission, value, vision, all of that is extremely important. But if you look at if you look at Prophet Muhammad, he created a culture of fairness. culture of fairness. And if you remember, he said that even if his daughter, Fatima, is found guilty, which obviously was not going to happen, he said even if she does it, she will be punished. What does this statement mean? As a leader, he was trying to make a point that the culture which we are building, we have zero tolerance for this. No nepotism, no bhaibandi, sifarish. Fairness is our value. Justice is our value. And we are going to establish a system where justice prevails, not relationships. That's why culture is so powerful. And that's why leaders need to develop cultures, whether that culture is of justice, of excellence, or maybe, competition, I don't know. So that's your role as a leader. I'll just stop here. So we stop at this, now we've covered the strategy/culture part. Any questions, any comments? And we'll move to the fourth one. G. Any questions or comments? Yeah, please, Yasir. ये बुला लें किसी को वो fourth लगा दें जी. Yasir, I remember it.
Yeah, as we said in the last slide, the culture is more important than the strategy. My question is, if we need to implement the strategy, obviously we have to shift the culture. But my interest is to know what kind of system you are implementing or recommending to implement any kind of strategy to build a culture. Is there any kind of system? Is there any kind of
No, there is no system.
technology?
Culture is based, no, so there is no technology, definitely. Culture is based on, values, and your why. So for instance, what do you think was the why of Prophet Muhammad? What was his why? I think his why was just one, to please Allah subhanahu wa ta'ala. Agreed? Now, in order to please Allah subhanahu wa ta'ala, he had to be fair. Simple. So culture is aligned with your mission. Now, for instance, imagine that my why is to become famous. Right? My purpose in life is to become famous. Do you think I will live a very fair life? I will compromise whenever I have to, because my purpose or the reason is to become famous. So in order to become famous, even if I have to compromise, I will compromise. So culture is linked with the why. So if your why is not based on values and ideology, you will not be able to develop a just culture or the culture which we are talking about.
Sometimes we can't see what we actually assume or giving the strategy to our employees. So we need to give a demonstration how actually we are going to shift the culture.
Yeah, that's what leaders do. They practice what they preach, they walk the talk, right? So for instance, if I am the leader and if I want to create the culture of excellence, I cannot perform, at a mediocre level. If I'm a trainer, then I have to be a good trainer. I cannot just, become a trainer or become a trainer come entertainer, right? Because a lot of trainers basically are entertainers. And they are cut, copy, paste. But people see through that. So my team will see through that, and they will see that their leader, although talks about excellence, actually is a mediocre person. So I will have to walk the talk first, right? In order to implement or establish something.
Sir, we have some questions if you want.
I don't know, you tell me, you are the boss.
So we do have short time. So would you be able to sum up the next two sessions in 30 minutes?
One session only.
One session, so 30 minutes. We
Yeah.
do have then time.
Yeah,
I can take few
I just
questions.
have one session now,
Okay,
so. Yeah,
okay, right. Let me read.
so we are recording all of this, right?
Yes, we are. So
So-
there are some, first of all, there are many comments appreciating your presentation. And secondly, there are people asking if we can share the slides of your lecture. If that's okay, we will share with the participants. If not, there is a recording available. We will be posting this on our YouTube channel as well, which is accessible all the time.
Right.
So they can, also come back and hear your lecture here at the YouTube channel. So let me ask first question, which has been posted by Dr. Suji. He's asking, don't we think this is colonial mindset, that mentalism, that our system never change? Equally, how down move from research to IP and commercialization?
Okay, don't we think this is a colonial mentalism?
Hmm.
There are systems never change. Yeah, I agree. Equally, how down move from research to IP and commercialization. But that's a different actually topic. That's an entrepreneurial conversation. So the question is related to the entrepreneurial side of that's a different question that is kind of out of the conversation scope which we are having. So I think that, and I'm an entrepreneur, I do that all the time, which you have mentioned, sir. So maybe what we can do is I can address this offline if we have all of this. And if we have the participants, then I'll look at the question and maybe I can respond to them separately, because this is overwhelming.
Yeah.
Mashallah. And I'm glad that, we have more than 100 people online and we have a very interactive audience. But I think this is overwhelming.
Okay, so maybe you want
Let's
to
start
move
with the
on?
4.
Okay.
But provided that, we are in touch with these people,
Mhm.
because, we should be responding.
We are, and I will also share, we also have their email
Yeah,
addresses.
especially the comments about,
The presentation.
appreciation.
Yes, of course, we have.
I'm just kidding.
Zahid,
kidding.
no, we have that if you want, it's
Yeah, I'm just
okay.
kidding. Yeah. So thank you very much, everyone. We are moving to the 4th session. Immediately again to save time. But thanks for appreciating and thanks for your comment. I am grateful and I hope that my why, why I'm here is because I have a very clear why to just sort it. And that's why I was grateful to Comstech and Dr. Iqbal and Smaila here, that you gave the opportunity for me to help more than 100 people. So we have actually touched around 150 people today, more than 150 potential and existing leaders. So this is value, this is meaning. So I'm moving to the 4th, which is a very interesting session, by the way, because these are global leadership models. These are not my models, these are global models. So what is it, changer? Okay. So global models of leadership. I'm going to talk about these 3 today. Obviously the best one is the 7 habits of highly effective people. This is my favorite, all-time favorite. That's why I got certified to teach this to everyone. Yeah, so let me start with the 7 habits. How many of you have read how many of you know of 7 habits? Okay. How many of you have read this book? Wow, mashallah. How many of you have properly read this book? Yeah. Because I get this answer, and so I do a lot of coaching and training, but coaching. So when I ask people, yeah, घर में पढ़ी है, पढ़ी आपने, हाँ पढ़ी है या पढ़ी है? So because we forget, right? We forget, simple. Anyways, so let's start. So the mission of Franklin Covey was to enable greatness in people and organizations. How brilliant, how benevolent this is, right? Enable greatness in others, helping others to become great. This is their mission. Their mission is not to make money, although they are making money. But they don't exist to make money. Keep that in mind. There's a difference between the two. And if I can explain, do we exist, and understand the question, do we exist to consume oxygen? Yes or no? Do we exist to consume oxygen? Oxygen. Do we exist to consume oxygen? No. We don't exist to consume, but we cannot exist without oxygen. So there's a difference. This is the same thing. Does my company exist to make a lot of money? No, my company exists to create value. But can my company exist without making money? No, my company cannot exist without making money. So there's a difference between the two, right? So Franklin Covey's mission is to help people. And that should be our mission, benevolence. What do we achieve after reading this book? This is what we achieve. Gain control over your life. How many of you would want to have control over your life? How many of you already have control over your life? So all of us want to have that. Focused and organized. Enhance your relationships. So again, once in a big audience, I asked, is there anyone, who doesn't want to enhance your relationship, or are you okay? So a guy stood up. Yeah, I'm perfect. I'm fine. So it was a kind of a round table. So people sitting around his table said, sir, he's not married. That's why he does not understand, what this is. But that was obviously a joke. Improve your communication and achieve. Now, these are maybe very simple things. But how many of you really, really believe that you have good communication? Or you communicate well or properly? In my experience, more than 90% of the people do not know how to communicate. We think that we communicate. We think that we can communicate well. But I can tell you that, and this is my area. This is one of the areas I do work more. Communication. And in patient safety and quality healthcare, one of the biggest reasons why we have preventable medical errors is communication. Anyway, so this is what you achieve after, but again, it's a simplification. So what is the 7 Habits of Highly Effective People program? It is a principle-centered, character-based, inside-out approach. To do what? For personal and interpersonal effectiveness. So the 7 Habits program is a principle-centered, character-based, inside-out approach. To do what? To develop interpersonal and personal effectiveness. And I have highlighted these 4. So I want to know if it was not a principle-centered, what would this have been? So that's the principle versus. No, versus. Principle versus. So you live a principle-centric life. Versus, as opposed to him, you live a life based on. What is the opposite of principles? Desires.
I was about to say selfishness.
So either you live a life of principles or you live a life of desires. Similarly, character versus personality. Remember, the macho, charisma. right? Inside out versus G. No. A approach. So these are approaches. There's a one approach is inside out.
So very shallow approach.
The other approach is outside in. Inside out means I take responsibility. Outside in is, oh, our leaders are corrupted, oh, our doctors are corrupt. Everyone else, everyone, he is corrupt, she is corrupt, everyone else is corrupt. Me, I don't know. I'm perfect, or I'm not even thinking about myself. The opposite is in 7 habits, we learn to start with myself, inside out. And yes, I know the whole society is corrupt, but I need to first see if I am corrupt or not. This is inside out, and the outside in is everyone else. No one knows how to drive in Pakistan. What about you? Right? So effective versus efficient. This is the most difficult part. What is the difference? So you understand the difference between principle and desires. That's easy. Character versus personality. That is also kind of easy. Inside out versus outside in. Makes sense. Effective versus efficient. Aren't these two the same things? Effectiveness and efficiency. No. Aren't these two the same thing? Yeah, okay. What do you think is the difference between effectiveness and efficiency? First of all, you think they are different?
Yes, they are different.
What is different?
I think effective and efficiency आपने already जो पहले बात की efficiency is more like कि आपने reactive phase में किया and effective sounds like proactive.
Sounds like.
To me.
Oh wait, Yasir, 7 habits. आप बता दें.
Effective, if somebody know how to do something, it means he is effective. He can do. But efficient, how much he can do it. थोड़े time में, कम resources में ज़्यादा काम किया.
What? So people.
Transformation or the translation.
People who have studied, engineering or mathematics or physics, they know what the definition of efficiency is, right? So as you said, Yasir said, achieving the maximum results with lowest resources in the least possible time. Yes, that's efficiency, right? That's the typical. Then what's wrong with that? What is wrong with being efficient?
Long term.
Sure. Effective. So, इसी से मैंने कहा था कि it's not easy to differentiate between efficiency because efficiency is also good. Efficiency is not bad. But then what is effectiveness? Right? So we'll see. Okay. I think personality and character, we know what that is, right? So personality is, the way I talk, the way I walk, the way I dress up, right? The way I greet you. But that's just a tip of who Dr. Zaki is. The real Dr. Zaki is hidden. And that is my character. That's not my personality. Okay. So now this is the big question in 7 habits. What is the difference between effectiveness and efficiency?
Efficiency is self-centered, more self-centered.
Let's see what it is. So let's see what this is. ये कहानी याद है ना? सोने वाली हड्डी, वो सोने वाला क्या अंडा, मुर्गा, मुर्गी. Yeah. A goose or a chicken or a hen or whatever gives golden eggs, and then this guy gets greedy, right? So, he kills this bird, whatever bird that was, because he wanted all the eggs. So he doesn't get those eggs. What does he kill? Yeah, good. And he is killing or destroying the capacity to continue producing results. That is effectiveness. Efficiency is giving results, which is fine. So Yasir is very efficient. Yasir works 20 hours a day and he delivers and he's brilliant. But I'm worried because Yasir is not effective. Why? Because his ability to continue to produce is getting compromised. That is effectiveness. And that is why effectiveness is a level higher than efficiency. So effectiveness is, again, I will repeat, effectiveness is the ability to continue producing results. Make sense?
Consistency.
The ability, no, again, please mark the word. It is the ability to continue, which means Yasir has to stop working 20 hours. Because if he continues to work 20 hours, he is losing his ability to continue to deliver. 3 words. Please respect the sanctity of words when you're trying to understand something. And I'll repeat again. Effectiveness is the ability, salayat, to continue producing results. It's a step higher than efficiency. Production and production capability. We are interested in both. Efficiency is just production. Effectiveness is production plus the ability. That's where the leadership comes in, right? Okay, what are paradigms? Paradigm is the way we look at things. Paradigm, Sunado, you have heard about this word, right? It's very famous. 7 habits. The terms mentioned in 7 habits are very famous, by the way. You may not even know that this term was coined by 7 habits, but you're already using those words or the terms. So paradigm, what is a paradigm? Paradigm is the way you look at things, or the glasses you use to look at things. Okay? I cannot go in detail again. Like I said, 7 habits. I conduct this workshop on 7 habits for 2 days or one very long day. And I'm trying to do it in 10 minutes, 15 minutes. This is actually criminal, but still I'm doing it. So this is the maturity continuum. Continuum means it doesn't stop. Continuum means it doesn't stop. It's not A to B and khalas. No, continuum means continues to repeat, continues, right? So these 7 habits are linked. So the first level of maturity, is dependence. The second level of maturity is independence. And the third is interdependence. The first level dependence is what? It's like a 4 months old baby. The 4 months old baby is 100% dependent. He or she cannot do anything. He or she is totally dependent on mother, right? How many of us are still at this level?
Emotionally.
Yeah, you got it.
Emotionally.
You're smart, right? And what does it mean? So, a 4 months baby, when she is hungry, what is she thinking? I'm hungry, but my mother is going to feed me. I'm not going to do anything, right? If I am wet, I'm not going to change myself. My mother is going to do it. So when you are emotionally dependent on a baby, what do? So I'm a 30-year-old adult, and I'm saying he makes me angry. She spoiled my day. I'm not taking responsibility. Everything which is happening to me is done by others. That's the dependence or the baby mindset. You understand the link, the analogy? The 4 months baby mindset, and the adult 40 years, 50, 70 years old guy, oh, I'm having a bad day today. Why? Because the rickshaw guy, you know, he spoiled my mood. So I'm in a bad mood, which means that I'm not going to deliver a good workshop. And you're looking at me and you're thinking, is he real? This guy came from Karachi, claims to be whatever he claims to be. And he's saying that because the rickshaw wala destroyed his mood, I'm not in the mood. And I'm cursing that rickshaw driver. And all of you are looking at me. What do you see? You see a 4-month baby, right? Yes? You see a 4-month baby who's not taking responsibility. Everything which is happening to me is by others. Right? That's dependence. In order to move from dependence to independence, we have to follow 3 habits. These 3 habits make us or move us from dependence, whether we are 10 years old, whether we are 30, whether we are 50, 40, 70, doesn't matter. We can all be a baby if we do not practice these 3 habits.
Can you explain, habit within with the end time?
Yeah, we started करेंगे. We started. सारे करेंगे. अभी so I'm trying to explain the continuum, maturity continuum. So now, here I was a baby, yeah, remember? As a baby, everything happening to me is because of you, You know, she destroyed everything. But now I'm following these 3 habits, so I've become independent. What's bad about being independent? The good thing is that I'm not a baby. But the bad thing is, what is the bad thing here?
They don't have to lead, they have to interact with the people and they have to have a culture and they have to.
What is the bad thing being here? The bad thing here is that now I'm arrogant. I don't need you. I don't need anyone. I don't need my team. Me, myself, I'm the one. I do everything. Or, and the most common thing, I'm a self-made person. Have you heard that? All the time. Do you agree with that? No, that's crap. Who is a self-made person? If I start counting the people who made me successful or who brought me here, I can go on and on and on. How can I claim that simply because if my father did not leave me, you know, let's say $10 million, and I started the business myself, I start claiming that I'm a self-made person. And I forget all of those people who came in my life, whether my teachers, my friends, you know, the first guy who gave me a break, my team members who supported me. I can go on and on and on. So that's arrogance. That's why we have to move up. So in order to drop the arrogance of independence, we again have to follow 3 habits. And then we will become interdependent. Interdependence is a humble paradigm or level, right? I need you and you need me. Whether I'm the CEO or you are just a manager, we all need each other. And that's why we collaborate. People who stay here, they may be very successful, but they do not collaborate. People who stay at independence, they do not collaborate. People who stay at dependence, they do not do anything. Right? They're a liability. They're a liability, emotional liability. But the ultimate level is interdependence. But then again, you have to follow 3 habits more. So you understand the continuum, the wisdom behind the continuum. Now let's, so the first dependence is paradigm of you. You take care of me. The baby paradigm. I call it the baby paradigm because it helps you to remember. Baby, अम्मी करेगी बस. कोई और करेगा. मैं नहीं कर सकता. Emotionally, I don't even consider myself to do anything. This is the self-reliant, the paradigm of arrogance. I don't need you. This is the paradigm of we, collaboration, mutual respect. Okay. So let's see what the first habit is. First habit is be proactive. Again, we've heard this concept, proactive, proactive, proactive. We've been using this proactive term since afternoon too. But what is real proactivity? Proactivity is taking responsibility. And what is responsibility? If you break responsibility, break the word responsibility, it is the ability to respond. Responsibility, ability to respond. Then what is respond? What do you mean by respond? Think about it or keep it. Second is begin with the end in mind. This is the define your purpose and mission in life. Why am I here? So what is my end? Always begin with the end in mind. Why do we do what we do? Third, put first things first, prioritize and simple prioritize. First things first. These are the three habits. If we master these three habits, we will become independent. And the most important is the first one. The most important. Then from dependence to interdependence, the fourth habit, think win-win. Again, you've heard this term, win-win, right? Everyone is using this term, win-win, win-win. It's not that easy to understand win-win. But let's excuse me. मुझे चाय ला देंगे? दूध वाली चाय, गरम चाय. Thank you very much. Have an everyone can win attitude. Everyone can win. Really? Really? Everyone can win? This is how is it possible? Ever since I can remember, it was either you or me. In school, remember? ये first आते थे तो मैं रोता था. So he came first, and my father wasn't happy because I came second. I'm just creating this because I never came second, right? So it was either him or me. Even in the race, it was either him or me. I've always spent my life, you or I. But everyone can win. Now we understand it's not as simple as it looks, but we still use this win-win, right? Fifth is seek first to be understood. Feast first to understand, then to be understood. How many of you do this? Most not, unfortunately. We all want to be heard. I want to speak. I want you to listen. We all do that. No one said, okay, tell me, and I'm listening. Are you a good listener? And do you listen empathetically? Or you're just listening to because you're waiting for your turn? You're waiting for your turn, right? The moment he stops, tap, so I'm not listening. We all do that. And that's why remember I said communication. Synergize. Work together to achieve more. उर्दू में क्या कहेंगे इसको? आप तो बता दें यार. आपको पकड़ दिया मैंने.
Basically, collaboration based.
नहीं उर्दू में बता. हैं? Synergize. No. What will you call synergize in Urdu? मैं जब बताऊंगा ना तो आप लोग फिर हैं? Sorry. Actually, I'm asking them because they all know. When I tell them, they say, "Oh yes, synergy is 1 और 1 11." So that is synergy. So 1 plus 1 is 11, not 2. Synergy is 1 और 1 11. So when two people synergize, they achieve more than 11, or they perform like 11 people. That's synergy. And that is why you see small teams with limited resources just like the Sahaba, very few people, the companions of Prophet Muhammad Sallallahu Alaihi Wasallam, but what did they have? They had synergies. They were synergistic. So a small group of people synergizing perform 10 times more than the sum of the individual components. That's synergy. And the last, which encircles all, is sharpen the saw. We'll talk about that. So the first is having a personal vision. Avoid reactive behavior. So proactivity is what? The opposite of reactivity. Proactivity is taking responsibility and avoiding reactive behavior. Okay? So I'm responsible for my choices. This is the see, do, get paradigm. See, do, get. What I see, then I do. And whatever I do, I will get. Right? So if I am looking at this person and I see with my glasses that he's not interested, this is my bias or this is my glass. What will I do? I will pick on him, right? Or I will ignore him. What will be the result? He will get disengaged, right? So we always see this, see, do, get. This is the result of our actions. And our actions are based on our paradigms, the way we look at things. So this is it. This slide is it. This is the $1 million slide. If you are able to exercise and follow this slide, you are, half there. So what this means is there's a stimulus for each of us. Something happens to us. Something happens to us. Now we can either respond, which effective people do, 7 habits of highly effective people. Effective people respond, but non-effective people, what do? They react. What is the opposite of response? React. What does this mean? This means, for instance, what's your name? Tahir. Sorry. Now Tahir, जो है वो मेरे से बदतमीजी कर रहा है. So, and Tahir is acting, is misbehaving. Tahir is misbehaving with me. And he is actually misbehaving, right? So, what is the stimulus? Tahir's behavior. Now, if I'm a reactive person, I'm going to react. And react is my spontaneous response kind of reaction. So he's misbehaving without thinking, I'm going to react. And what's the result? The whole workshop gets messed up. But if I'm a proactive person, Tahir is still misbehaving. Tahir is misbehaving. The stimulus is Tahir is misbehaving. But if I'm a proactive person, I know that I have the freedom to choose my responses. So now, for my online participants, you can't see what I'm doing, but Tahir is misbehaving and I'm looking at him. And I'm using what? The freedom, the time between the stimulus and the response. And what am I doing? I'm using these endowments. So I'm thinking, if I react, what's going to happen? Workshop will get messed up. Dr. Iqbal is going to be unhappy. People will make fun of me. I will regret it in future. All of this I'm thinking as a proactive person while he's misbehaving, using this 1 second or half a second. So proactive people, what do? When any stimulus, they get a stimulus, they use this space. I'm repeating. Proactive people use the space between stimulus and response. And what do they use the space for? Self-awareness, imagination, conscious. Imagination is what? If I react, Khazima is going to be unhappy with me and Khazima is going to then, that's imagination. Self-awareness, this is not my value. When, so let's say, a lady is misbehaving. So my values are that I won't, fight with ladies. That's my value. So I am reviewing all of this and I know that I have my independent will. I know it is in my control. And I'm just looking at him, not doing it. And he's continuing to misbehave. And so I am in control. That is proactivity. But say for instance, let me just exaggerate this. He is misbehaving so much that I get so angry that I come and I slap him. What's going to happen? He's going to be unhappy, right? Dr. Iqbal will be very, very unhappy. Dr. Smiler will be very unhappy, right? And I'm going to regret it after 2 minutes. Yeah? What did I do? I did not use this time and I did not use these endowments which I had. Do you understand the difference between proactivity and reactivity? Proactive people are different, people on a different league. Proactive. Reactive people just react like, neither. You hit me, I'll hit you. Right? You say the bad words, I'll say worse words. Come on, hit me. These are like, okay. Come at me.
Can foresee.
Proactive people may foresee, but even if they don't foresee, whenever something happens, and we say that they know the habit, they use this, practice the pause. So whenever something happens, pause. Pause to do what? Use this time. Use this time to do what? Self-awareness, imagine, conscience, independent will. Review all these four and then decide my response. Okay? I cannot go deeper. Although this particular section of the 7 habits takes hours and hours. And it should, because this is the most important part of 7 habits. If you have achieved this, oh, you're there, really there. Second, circle of influence. Remember I told you that if I want to start an orphanage, I'll probably start it in Karachi. Right? Not in New York. It's not that I'm not concerned about kids in New York. I am concerned. But my circle of influence is Karachi. I'm from Karachi. If I were from Islamabad, perhaps I would do it in Islamabad. Right? And in Karachi is big. So I do it in my neighborhood. My neighborhood is my circle of influence. Effective people focus on their circle of influence. That is why effective people do not spend a lot of time watching talk shows of Sheikh Rashid. Sorry, I have nothing against him, right? I have nothing for him too, but nothing against him, just trying to make a point. Why? Because if you sit in front of a talk show for 2 hours, you are focusing on your circle of concern. Because that concerns you, yes, but it's not circle of influence. And you will also realize this was a waste of time. You didn't achieve anything. But proactive people would have done something very, very significant. Like Dr. Amjad Saqib in Afuad or Dr. Bari in Indus Hospital, or right, focusing on circle of influence. Spending those 2 hours in a meaningful way. Those are proactive people. Habit 2, personality. How do purpose and vision? I think we've talked about purpose and vision. Begin with the end in mind is the why. So we've talked a lot about that. I'm the creator of my future. I develop a personal mission statement and I have a sense of purpose, meaning in my life. Right? Habit 3, habit of personal management. Put first things first. This is the discipline side. And this is, I focus on what is important, not on what is urgent. There's a difference between urgent and important. Please remember that. I plan my time according to my priorities. Go back to your roles. So if you are a mother, and if you are also a friend, and if you spend all your time with your friends, what are you doing?
Protecting my.
Because your priority is your kids, right? So proactive people are always cognizant of their roles, priorities, and then they spend time accordingly. So this is the world famous time management matrix. I don't know if you've seen this before or not. And this matrix is about urgent, important, not important. So this is the quadrant. These are 4 quadrants, right? So the first quadrant is urgent and important. Urgent is for you. Important is for me, right? So I want to spend time in this second quadrant, which is not urgent, but it is very, very important. For those who know how matrices work, it will be easy, right? So X and Y axis. So this quadrant number 2, we call it prioritizer. This is my planning quadrant. I'm not attending to urgent matters. I'm attending to what matters? Important matters. I am attending to, I am investing my time more on important matters in quadrant 2, less on urgent matters. This is the guy who watches talk show of Shivaji. Not important, not urgent. Turn program, if I can say that. Turn. Waste of time, right? Slacker. This is the yes man. Because he spends most of his time on only urgent matters. And he's a typical reactive person. अच्छा आपने काम किया जी सर फिर मैंने कहा या अच्छा ओके सर मेरे सारे अपने काम रुके हुए and I'm pleasing him, I'm pleasing you, and I'm just serving others, right? I'm not, because I'm in this quarter, which is not, this is not important, but this is urgent. It's urgent for you, and it's not important for me. Okay? So अब हमने क्या कर लिया? So after the 3 habits, are we still babies? No. But now the problem is that potentially we have become a little arrogant, because now we are independent. So we have to become a little humble, so that we become interdependent. अजीमा वो साहब चाय लाए थे और अच्छा गुमनाम नहीं हुए वो पीछे से लाए थे Phillies seal. Oh, sorry. I'm just stopping for half a minute for my tea. For those who are online. So everyone is using the time, but I'm back. So the 4th habit is win-win. Again, there are 2 habits which are difficult. The first one, proactive, and the 4th one, win-win. Because I gave you an idea. All our lives we have competed. All our lives we have competed. Ever since we were a child, we were a kid, we competed with others. This is how we have been, developed. And now 7 habits is saying that you don't need to compete. You need to cooperate and collaborate. And when you cooperate and collaborate, everyone wins. You win too. So everyone can win. Okay? So I get better results by cooperating rather than competing. I persist in looking for a win-win outcome. What does this mean? This means that I will continue to negotiate until both of us win. But the reactive people, what do they do? They want to win, even if the other person is losing. They want to go for a deal where they emerge as winners, even if they're exploiting others. Effective people, proactive people do not do that. And they ensure that both of us or everyone, and we can do that. We have exercises to show. I get mutually beneficial results. Kamal, आप जरा प्लीज अहमद से पूछ लें मेरे टिकट का कंफर्म कर लेता हूँ reconfirm कर लें please, thank you. So win-win is this. How do you achieve a win-win relationship? Consideration and courage. Oh, consideration and courage. So courage to do the right thing, and consideration is empathy, you know, considering the other person. अगर आपके अंदर consideration, if you have more of consideration and less of courage, you will move to lose will. You will be so considerate that you will lose yourself and you will let the other person win. But if you are more courageous and less considerate, the courage will want you to win even if the other person is losing. Because this is again a matrix, you know, you need to understand how matrices work. So this is the second quadrant, is the ideal. So you are courageous enough, you're not going to lose. So it's not going to be lose-win. It's not going to be win-lose. It will be win-win. Both of us. And for that, these are the two skills or qualities. As leaders, we need to develop both of these: empathy and courage, consideration and courage. So leaders and proactive, effective people learn how to develop or create a balance between courage and consideration. Whenever you tilt this balance, you know, you go to a different extreme. I'll skip this. Habit 5: seek first to understand and then to be understood. This is empathetic communication. So as soon as we say, Taisa, okay, help me to understand your viewpoint, and I'm listening. And I'm really listening. I'm not waiting for my turn. I'm listening. And with the intent to understand his viewpoint. Empathetic means going in his shoes. And he has something to discuss with me, and he has a, you know, he has an issue. Okay, tell me about it. What happened? And I'm really interested to understand your point of view. And after that, I say, okay, fine, now I understand, you know, what you are feeling. Then I will respond. So this is empathetic communication. Okay, so if I listen to understand, I will be understood. Okay, thank you. I use empathic listening skills, I achieve mutual understanding. If I just want to blah 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 blah, it will be a lose win win lose. No, not win win. Okay, synergize. Remember the habit of creative cooperation. Why have we used the word creative? Because 1 + 1 cannot become 11 without this concept of creating something new. Just like when two people, a man and a wife, create a new life, right? And I'll give you an example. So, ek aur ek 11. So you can say that, you know, the barakah comes in when you work together with this intent of synergy. There's barakah and there's teamwork and there's trust, and you know, people, you cover my back, I'll cover yours. I want to make you successful, you want to make me successful. All of these things create a small army, you know, 2-man army, 2-woman army, right? So that's synergy. I value differences than others, and you cannot synergize unless you have the courage to value differences in others. And that's again where the bias comes in. If I am in the US, I want to sit with a Pakistani. Right? Even if I'm in the mosque, I want to make friends with the Pakistani. Right? Let alone, and all of the people in the mosque are Muslims. Even then, I want to be with a Pakistani. And if I have 5 people, I want to be a person from Karachi, maybe not from Multan or Lahore, right? Let alone making friendship with a Chinese Muslim. Because most of the time we don't value differences, right? So we have to value the differences, and then we seek the third alternative, and that creates better results. So value the difference is the key. Value difference, embrace difference, embrace it. Embrace diversity. Why is Silicon Valley the most innovative city in the world? Why? because every nation is there. So Muslims, Christians, all religions, all nationalities, black, white, Indians, Chinese, yellow, everyone is there. Diversity creates innovation and entrepreneurship. And not because I'm from Karachi, but why is Karachi more innovative? Because Karachi has always had Hindus, Christians, Parsis, all different minorities and races, and so that created diversity. And it was obviously a port, diversity, entrepreneurship. So diversity creates innovation. And you achieve that by valuing the difference. The second is the most important. Sharpen the saw. It's very simple. What is sharpen the saw? Habit of renewal. Exercise is habit of renewal, right? Habit of renewal. Exercising, reading, praying, meditating, all of that. So to improve, I must renew myself regularly. How many of you exercise regularly? Okay, makes sense. So people who do not exercise, the most common answer is, I don't have time. Yeah. I exercise now, but all my life I have not exercised. And the reason was I was very busy. I didn't have time. So how many times have you not put gas in your car because you don't have time? Never. Because if you don't put gas means petrol. If you don't put gas or petrol in your car, the car will stop. So you find time to fill your tank. You find time, you create time. Yes? But we do not create time for exercise because we don't believe in the habit of renewing ourselves. That's why we call sharpen the saw. So you need to get recharged in all of these domains. All of these domains. Physical, mental, spiritual, and social and emotional. All of these domains, you need to recharge, renew yourself. Otherwise, we will not be effective. What is effectiveness? The ability to continue producing results. So if you don't exercise, you will not be able to produce. If you don't pray, if you don't help people, you will die. Okay, so I can just skim through the two models. But this is huge, right? There's too much information. So do you want me to do that or stop here?
I think so, because we also have to do the certificate.
Yeah, I think we should stop otherwise, because 7 habits is the, so let me give you this model, right? The care and growth leadership model. Because this really links with the essence of what I've been talking about. So this model was presented by a South African Skitima. Mr. Skitima is a revered Muslim. He was not a Muslim, he reverted to Islam back in the days of South Africa, when you could actually count Muslim, blue-eyed Muslims on your hand. And he came up with this model of leadership, which he called care and growth model. And he states that leadership is about 2 things only. Leaders care for their people, and leaders develop their people. Khalas. And that's why I wanted to talk about this. Leaders care for their people. Who does this the most? Prophet Sallallahu was the leader, that's why.
Parents.
Mother. Even in parents, mother. Thank you. Mother does only 2 things. She cares for her children and she develops them. And who does more than the mother? Allah subhanahu wa ta'ala, right? But this is the perfect model of a perfect leader. And this is transactional leadership or transformational leadership? Transformation, right? Not transactions. So I just give you this as well. I'll just show you this. So this is another model, this is called grid. Grid is a model of leadership which talks about, again, a matrix, concern for production, concern for people. So I am the CEO, you are all my team members or employees. Am I a leader who is concerned for production or concerned for people? So the perfect leader has to create a balance between concern for people and concern for production. Concern for people is, I have to take care of you, the leadership model, care and growth. What is concern for production? Obviously, you guys need to work. So if you're not working, right? If you're not working, so I'm low in production, then I'm not here. 9-9 is the ultimate. 9-9 is the perfect leader because he or she has highest level of concern for the people, and he or she also has the highest level concern for production. So that's her job. So this is another model, very famous, it's called grid, right? So I just thought I should, that was presented in 1960s. And I certified, this was a 5 days workshop, can you imagine? And I've just came through this for in 2 minutes. But why I'm saying that is because imagine people, you know, very senior people, like chairmen and CEOs, for 5 days, we were just studying this model, grid model of leadership. 5 days. Starting from 8 a.m. till there was no end. Could be 9 p.m., could be 8 p.m., could be 10. 5 days, only grid. So I did that certification. And that's why I wanted to share that. Concern for production and people. So ideal leaders create a balance between both. Not only people, but both. But when they concern for people, they care and grow their people. So I'll stop here. We are over time. And I think if any burning questions, I would love to take questions. Otherwise, we can stop here. Yeah, thank you very much.
Thank you very much, Dr. Zaki, for an excellent workshop, I must say, something that is very new to what Comstech is already doing. And I understand your concerns regarding the time limitation, and I hope that in the future we will be able to have workshops or a training only concentrating on individual leadership models, so that you are able to cover comprehensively these models. So before we conclude and we request you and Dr. Dayalu to distribute the certificates, I would request our participants if there are any feedback or comments that you would like to share for with and for Dr. Zaki. Anybody who would like to share of what you have learned, how? Yes, madam, please.
Thank you very much. I think we are a professional, we are a leader in our specific profession, but the things that the self-development and to think out of the box, that was very good workshop. We learned a lot, self-awareness, a lot of another like changing the mindset, adaptability, and thinking the leadership in another way.
Right.
What we learned. And we also have to carry forward this message where we are working, and we have to build leaders, not just
Mm. Thank you very much, madam. Madam, please kindly introduce yourself before. Yeah.
My name is Rani Kara. I think it was a very comprehensive, but still I feel that we needed a time because there was a lot to be discussed, because there are many gray areas which need to be addressed carefully. I think so this was a starting point, and we have comprehensively covered, it helped me really to rejuvenate myself as a leader.
Madam, thank you very much, and thank you for both of you for your comments and all of you for coming. Anybody else would like to share anything? Makaka, would you like to say something? Makaka is my colleague working at Comstech. So Makaka, I request you to please say something about this training.
Thank you very much. Thank you, Professor, for his insightful presentation. I learned a lot today about this leadership training session. And, yes, I think we need more time for research and to go deeper in one
Yes.
leadership model.
Yes, Makaka and I are going to convince Dr. Iqbal next to us. Okay, thank you, Makaka.
Just announce, I have this. So all the participants, online participants, as well as all of you, you can connect with me on LinkedIn. And then if you have any individual request or a question, you can just post your question and I will try to respond, inshallah. And you can email me. My email is zakiuddinahmed@gmail.com, ZAKIUDDINAHMED@gmail.com. I'll try to respond, but I think we should connect.
Thank you.
Maybe we can create a group.
We can
Yeah.
create a group.
WhatsApp group or something.
Yeah, and also there are so many comments about your presentation online as well. People who have joined us from Malawi, he's saying thank you very much for the great presentation. There are so many queries about the fact that if the participants will be able to have your presentation about presentations. Okay, anybody else? Okay, so Dr. Ismail, would you like to say something, please? The floor.
For asking this person is Dr. Zaki. And my concern is in medical infrastructure, hospitals. This kind of training will be very useful because many times they don't have the respect to the patients. If they receive some patients, they are in a hurry to what to do what they want to. They think it's better for the patient and the patient is giving, but they don't take a lot of time to discuss with them and to give them make them very confident. It will help patient to recover health quickly.
Okay.
I don't know what the plan for this one is.
I organize these workshops very regularly in hospitals. All over Pakistan.
We need it also in Africa.
Yeah. You invite me, I'll be happy to come.
Kazima, you will see this professor how to begin this training. Yes, ma'am.
If anyone wants my card, you can have it from here.
Okay, so may I request Dr. Zaki and Dr. Ismail to please give certificates to the participants? Guru, may I certificates?
Thank you, the online participants. I would like to thank all of you for showing up in such large numbers. We had more than, I think, more than 110 or 115 online participants who stayed for the whole workshop, the session, and we had around 50 plus in person. So I'm really grateful, and I will try my best to address the questions which were presented online on chat, and Ms. Kazima will help me. But I wanted to thank you again. So thank you very much. Assalamu alaikum.
And you will also receive your certificates, e-certificates through your email. So please check your emails. We will be receiving them in a week's time. Okay, so. So I request all the participants to please come on the front for a group picture with us.